am calling to order the special board meeting of August 3rd at 4 p.m. This is a special board meeting which we are authorized to provide under extraordinary circumstances. And we have one item before the board today. It's one action item. It is a resolution directing the chancellor to develop and implement a COVID vaccine requirement to increase vaccination rates for students, faculty, and staff. And before we move into the presentation, we will have a guest speaker to frame the issues. But I also at this time want to invite members of the public who have joined us and would like to provide public comments. You have two options to offer public comment during the live board meeting. If you're on a computer, you may use the Q&A function, which is at the bottom of your screen, to submit your full name and the matter of which you wish to address. If you're participating by phone, you may remotely raise your hand by dialing *9. Excuse me. When your microphone is unmuted by the clerk of the board, please provide your full name and the matter you wish to address. Let me remind you, you have no more than 3 minutes. I encourage you not to be repetitive. Once we have confirmed the number of public comments, I'll call on each of you individually. When your name is called, the clerk of the board will unmute your microphone. And again, you have up to 3 minutes to speak. Before we go into our guest speaker presentation before the action item, I would ask that our legal counsel provide guidance on our ability to hold a special meeting. And if you, Jake, would sort of convey to the public and our board members and our participants our authority under law to hold a special board meeting.
Absolutely. Thank you, President Ortiz, members of the board. The Brown Act, as you're all aware, is the provision of California law that governs the public meeting of local public entities, including community college districts in the state. And there are a couple of different types of meetings that can be held consistent with the Brown Act with different noticing requirements. For a regular meeting of the board, we have the 72-hour notice requirement, publishing the agenda on our website and posting it at least 72 hours in advance. And of course, the board is limited to take up any actions here, discuss, deliberate items that are on the posted agenda. The Brown Act also allows for what are called special meetings that can be called with 24-hour notice. So similar idea, the notice and agenda has to be posted at least 24 hours in advance. This is a special meeting of the Los Rios Community College District Board of Trustees. The notice and agenda was posted in advance, more than 24 hours in advance of this meeting. In fact, it was posted on initially on the website last Friday. So we've well met the notice and publication requirements to hold this meeting, this special meeting of the board, consistent with California law.
Thank you for clarifying that, our legal counsel, and I think that's important given the circumstances. With that, I understand the Chancellor will be introducing our guest, and after her presentation, our Chancellor will take up the action item, and at that time, after his presentation, I am going to want to just sort of define the parameters for the trustee conversation and deliberation. But with that, let's, Chancellor, if you may, introduce our guest.
Well, thank you, President Ortiz and members of the board and interested citizens as well. When the board asked us to consider the options to help protect the health of our students, faculty, and staff, one idea for this meeting was to reach outside of our organization and make sure we heard from a public health official about some of the changes that have happened with COVID-19 and how rapidly things are changing. And I can't think of a better person to share that perspective than Dr. Glenna Trochet, longtime public health official in the Capital Region, with Sacramento County and many other organizations throughout the region. So an experienced veteran in public health, someone who has worked through not one, but two pandemics in her career. So I could say many more positive things about Dr. Trochet, but in the interest of time and giving everybody a chance to hear from her as quickly as possible, Dr. Trochet, I will turn the floor over to you.
Well, thank you very much for inviting me to present today, and for your kind words. For those of us who have been working in medicine and public health during this pandemic, we have learned that knowledge about this coronavirus that causes COVID-19 is very fluid and changes quickly, sometimes by the hour. Several weeks ago, it looked like the pandemic might be coming under control, but the situation has changed again, with public health in Sacramento and in Yolo County and across California asking everyone to wear masks in public again, regardless of vaccination status. What I am sharing with you today is what I know to be so as of right now, but it is subject to change as we learn more about this pandemic and the viruses. Currently, Sacramento County, and I chose Sacramento County as an example, is experiencing a surge in cases of COVID-19. As of August 2nd, yesterday, they were reporting 116,923 cases with a case rate of 23.3 per 100,000 and a test positivity rate of 8.8%. The dominant variant circulating right now in all of California, including Sacramento County, is the Delta variant. This virus is much more contagious than previous variants or the original virus. It may also cause more severe disease in unvaccinated people, although the studies about severity are still preliminary. Let me give you a comparison. In May of this year, California was reporting 1.9 cases per 100,000. And across California yesterday, they were reporting 16.7 cases per 100,000. In June, test positivity rate for California was 0.7%. As of yesterday, it was 6.7%. The lowest hospitalization rate in June in California was under 900 across the state. As of yesterday, they were reporting 5,120 hospitalized patients across the state. The vast majority of the new cases have been among unvaccinated people, with 600% higher case rates among the unvaccinated people than for those who are vaccinated. Although the Delta variant does appear to infect vaccinated people to a greater degree than the other variants did, and than the original virus did. The folks that are coming down with this virus are younger and tend to be healthier than the people affected during the first wave of the pandemic, and yet they're still being hospitalized. The 3 authorized vaccines against COVID-19 are very safe. We know this because of the over 346 million doses given in the United States and the over 4 billion doses given worldwide, with life-threatening side effects being very rare. An FDA emergency use authorization requires extensive data and studies before it is given, and does not imply that the authorized test or treatment is rushed or unsafe. Both Pfizer and Moderna have submitted their data to the FDA for expedited approval, but we do not know when that approval will take effect. Until the Delta variant appeared, the vaccines were unusually effective in preventing infection, illness, hospitalization, and death in vaccinated people. The vaccines continue to protect against severe illness, hospitalization, and death. However, the Delta variant does infect vaccinated people more, and more alarmingly, people who are vaccinated who get infected with this variant seem to be able to transmit it to others. Whereas before, even if people got infected and had a breakthrough infection with a different variant, they didn't seem to transmit it as easily. Many people don't have any symptoms at all when they get infected, but some people do. As more people develop COVID-19 and the virus multiplies billions of times, another variant could arise that escapes altogether the immunity given by the current vaccines. One way to avoid this and to stop the spread of disease is by testing, isolation of people who are sick, and quarantine of people who are exposed, and also by vaccination. Testing, isolation of sick people, and quarantine of exposed individuals is very effective in stopping the spread of any disease, including COVID-19. But these are very intrusive strategies that interrupt the normal flow of life. While vaccinations can stop the epidemic with very little disruption, other than side effects that are overwhelmingly, in the overwhelming number of people, fairly mild. Thank you for considering a vaccination requirement, given the political storm that we are all living through. And I am available to answer any questions you may have.
Thank you for that presentation, Glenna. And Chancellor, we didn't discuss this ahead of time, but I do think it is an opportunity for trustees to ask the questions of Dr. Trochet. May we allow that time?
Certainly.
Wonderful. So let me open this up to trustees. And I can't see because the agenda's up, but are there questions or need for clarification from any of the trustees? I'm not hearing anyone jump in. I'm not seeing hands up.
Do you see mine?
Oh, no, it's hard because I have only a column on the right. So thank you for
Okay.
jumping in. And anyone else, feel free to jump in.
Thank you so much, Dr. Troshett. I really appreciate this is Pam Haynes, I'm a trustee. I appreciate your presentation. My concern is that while one county may be doing well, our counties are porous. In other words, we especially in this region, there's 5 or 6 counties in which we drive back and forth between for work. And so that's one of my concerns. And given that our district covers multiple counties, I think it's really important to be considering a requirement for vaccination. I had heard that you had mentioned some rates. I had heard that the Delta variant is 10 to 12 times more potent relative to COVID-19. Can you illuminate us on just how dangerous that might be?
We know that the Delta variant is much more contagious than any of the others. The CDC recently released data that indicated that it's as contagious as chickenpox is, which is fairly contagious. If you've been exposed to chickenpox, you're very likely to get it. I can't give you a number. I don't know that it has been quantified yet, but I can tell you that the people who come down with this virus, when the tests are done, the number of viral particles that they are shedding is much higher than with any of the other variants or with the original virus. And more alarmingly, vaccinated people who get infected with the Delta variant seem to have the same number of viral particles as the people who are not vaccinated. They don't seem to get as sick. They don't end up being hospitalized nearly as often. But they do seem to be able to spread the disease and to be infected and to infect other people. Whereas when they got infected with the Alpha variant or the original virus, once vaccinated people didn't seem to be able to spread that.
Thank you for that response. I do have a follow-up, and it goes to, we've been talking about young people, and I think that what really truly concerns me is, and maybe I shouldn't be as concerned, so you might want to talk to us about the increase of children who are under the age of 12 who have not. There is no vaccine, and the number that have been hospitalized. Is that something that is growing, or is it an anomaly? how should we be thinking about that transmittal, especially when we're talking about our faculty and our students who are our older students, as well as our staff who go home to their families and to their children.
Yeah. This has become really an epidemic of the unvaccinated. And as you pointed out, children under 12 don't have a vaccine available to them yet. So we are seeing the numbers of infected people being younger because it is becoming the pandemic of the unvaccinated. So we're seeing more children being reported as being infected with COVID-19. We're not seeing that much of an increase in hospitalizations for children. Some of this may be just because the epidemic has moved into that age group because they are the ones who are unvaccinated. I do not have any data that this variant is any worse for children than any of the other variants at this time. That is knowledge that we may be getting in the future, but I don't have it right now.
Thank you.
Questions from other trustees? Okay. So I'm trying to scroll and see if there's anybody that's, no one's jumping in.
I have a question. This is Kelly
Okay.
Wilkerson. I thank you very much for the information, Dr. Trichet, and we want to, make this determination based on public health and science. So it's very nice to have you here to answer our questions. And I'm wondering if you can talk about kind of the interplay between a mask mandate and a vaccination requirement, how they work together, if they are both necessary in order to protect students and faculty and staff.
Okay, so over the course of the last year and a half, we have learned that masks are actually very effective in preventing infection as long as they are accompanied with other strategies such as social distancing, frequent washing hands, good ventilation, and enclosed places. They do work fairly well in protecting folks, particularly when there is low circulation of the virus. The more virus that is circulating, the higher is the risk to everybody, including people who wear masks. But they are a good strategy to use, particularly when there is a very high circulation of viruses there is right now in most of Northern California. They're not as effective as vaccination. Vaccination, so far, the vaccines that have been in use definitely protect to a very great degree against severe disease, hospitalization, and death. So although masks are good and can be used in addition, if we want to put a stop to infections, we absolutely have to vaccinate. The other benefit that vaccination has is that it reduces the number of people who get sick, which reduces the opportunities for this virus to mutate even further.
Right. Other questions from trustees?
Dr. Trochet, this is Trustee Johnson. How do we know how much of the virus is circulating
We know that
in any particular place?
Yeah, we know that by the positivity rate. They are indirect measures.
Oh, okay.
The number of people who are coming down with the disease per 100,000 every day is a measure. The positivity rate, how many tests of the tests that are being done, how many are positive? And the rate of people coming down with the disease, being diagnosed with the disease, has been increasing over the past few weeks. From a low in May of 1.9 cases per 100,000 across California to 16.7 per 100,000 yesterday. And the
Okay, so it's not
rate,
like there's any sampling of the air going on, something like that.
No, it's based on number of people who are sick, number of people who are dying, number of people who are hospitalized, and the positivity rate of the tests.
Okay, thank you.
Other trustees with questions or comments? All right. So, Glenna, thank you again. I had worked with Glenna years ago when I served in the Senate and chaired the Health Committee, and she is recognized as a leader across the country in the area of public health. And you've actually overseen at least probably three, perhaps four pandemics between SARS and COVID-19 and the several. So I appreciate and trust your guidance. I guess one of the complex questions is, at what point does government mandate vaccinations? And if you could just share comparable examples in which we have required vaccinations historically in this state, just to validate that we indeed have the authority to do so under certain circumstances.
Yes, when the polio vaccine became available, it was in the middle of a polio outbreak in the 1950s and early 60s. And many people eagerly had their children and they themselves were vaccinated against polio. However, we were not able to end polio outbreaks until the vaccine was mandated for entry into schools. At that point, even though there had been a lot of education and many people accepted the vaccine early, it really wasn't removed from our psyche until it was required for school entrance. The same has happened with measles. Measles is extremely contagious. You need to have about 95% vaccination rate if you're going to stop any measles outbreaks. And again, when the vaccination rate for measles goes down below that threshold, we start seeing outbreaks of measles in congregate areas like schools. And again, measles was controlled once it was required for school entry. So those are two examples of ways in which public health and others have mandated vaccinations.
Thank you for that. And this may or may not be a statistical response that you can give, but the cost benefit analysis of the vaccines thus far, I mean, we are 18, 20 months into our understanding of COVID. Lots of information as we were building the data. But I mean, can you give a kind of just a statement or analysis of the cost benefit analysis, of risk benefit analysis of the vaccines as we know them today, to enlighten us in terms of a really important decision we're about to make?
Okay, most of the risk benefit assessments are overwhelmingly in favor of vaccination. The risks of COVID-19 for someone who comes down with it, it causes a whole spectrum of disease from very mild and even no symptoms to very severe and even death. But at least 10% of people who come down with COVID-19 have long-term symptoms or are affected long-term. With some folks end up with damaged lungs and having to have oxygen permanently. The virus infects the heart and can cause heart attacks. It causes clots and causes permanent disability. So every risk analysis I've seen of the vaccine versus getting the disease has shown that overwhelmingly it's in favor of the vaccine. I can take a look to see if it's been quantified. I'm sure it has been, but I can't off the top of my head give you a quantity. But overwhelmingly, it's in favor of having the vaccine versus allowing people to get sick.
Wonderful. Thank you for that. And I think it's important to highlight those symptoms that you elucidated actually were as if the risk of someone who is actually diagnosed with COVID-19 in terms of the long-term effects and hospitalization and death. So I appreciate that.
Deborah, this is John. I've got a question for the doctor. Um, the approval of the 3 vaccines that we're using were approved on an emergency situation. Not being very scientific, it appears that the vaccine is working quite well. Could you comment on the difference or your concerns or lack of concerns between the emergency approval versus a formal final approval?
Yeah, an emergency use authorization requires extensive data to be submitted. It's not done on the fly. It doesn't require the time span needed for additional information that might take over a year. And that is the only difference between an emergency use authorization and a full approval. The full approval requires companies to follow vaccinated people for over a year. And it was thought that with this pandemic, it was not possible to do that. And that because the studies were so positive that they should be able to give an emergency use authorization. Since then, over 346 million doses have been given in the United States, and over 4 billion doses, not just of the 3 authorized ones here in the United States, but of other vaccines also have been given worldwide. And we have seen overwhelmingly that they are safe. Yes, there are some life-threatening side effects from this vaccine, as with any medical intervention, but they are rare compared to the benefits of the vaccine.
Thank you, John. Pam, did you still have a question? Okay. I think that takes care of if there's anyone else, trustees, that want to jump in, I think that takes care of trustee questions, and you're welcome to stay along, and if necessary, perhaps there may be further questions, but if you have to leave, I totally understand. But I really appreciate you joining us. I do think that we needed to have science and public health guidance on this important decision, and you have more than fulfilled my hope and expectation, Glenna. Thank you.
Well, you're welcome. I will step out now if that is okay, but if you text me, I will get back on if you need me.
Okay, I will do that. Thank you, Glenna. Again,
thank you.
Appreciate it.
Bye now, and thank you all very much.
Thank you. Chancellor, do you want to prepare to take up action item A? And at some point, I would like to sort of frame the discussion after you present, but I do need to check in to see if we have speakers that have signed up with our clerk.
We do. I have at least 19 that have submitted their name via the Q&A function, and then I see currently 24 hands raised as well.
Robert, did you want to say something? Oh, no. Okay. Jennifer, I don't know how to get that list. Which option should I rely upon to get the list, or do you want to wait till it's complete before we have them present public comment?
If you'd like, I can type it up and share it in chat with you, or I can just read the names when we're ready to start that process.
That would probably be easier because I don't write that fast.
Okay.
Chancellor, trustees, do we want to open this up for public comment now or after your presentation?
President Ortiz, I'm comfortable either way, whatever the preference of the board is. This is in some ways unprecedented with the volume of public comment. So we want to certainly have an opportunity to hear from the public and also have the board to have adequate time to address these really challenging issues. So
Chancellor, I would ask you to indulge me and let us hear from public comment first. And if there are items that warrant clarification or response between you and the trustees, we could probably handle that. So let's go ahead and take public comment now. And let me just remind the public comment commentators that you have 3 minutes, up to 3 minutes, to the degree you can, not be repetitive, that's helpful. And to the degree it could be focused on policy and the action before us versus political statements, that would be helpful. We do have a provision that allows us to ensure that it's on topic. So with that, Jennifer, let's go ahead and begin inviting the speakers for public comment.
The first speaker will be Greg Beyer.
Thank you. My name is Gregory Beyer. I am an employee of the district, but I speak tonight as a constituent of the board and a member of the community. I am a survivor of COVID-19. I'm the parent of 2 survivors of COVID-19. My elderly mother lives 4 doors away from me. I strongly encourage and support the board's action to require every single person setting foot on those Rios campuses to be vaccinated. Thank you.
Thank you, Greg, and I'm glad you're back and doing well. Thank you. Next speaker. Jennifer?
Yes, I'm sorry. I'm searching for the next speaker.
Oh, sorry.
That's okay. It's going to be Patrick McDonald.
Hi, I prepared like a slideshow. Can I share my screen?
You have 3 minutes. I don't know that we have the technology to share a screen, but if you could summarize.
We don't.
Okay, I will try to summarize. So what's going on, in my opinion, is that you have a world where people have been looking at the unvaccinated versus the vaccinated, but there's another group, which I will call the had the disease group, among which I'm one of them. And since I don't have my notes in front of me, I can tell you that there's evidence that the T cell response among those that are vaccinated is insufficient compared to the T cell response of those who had gone through the disease. And there's proof of this from the Cleveland Clinic, where I forget what the numbers are, but 0 people with the disease got it again versus 15 in the study without, and this is a study of 56,000 some people. I wish I had my notes, but to close it off, I guess you have the Gamma variant, which is from Brazil, and it is causing Brazil to be the #1 total death population because it's fairly dangerous. And you have the Lambda variant from Peru, and it's causing that country to have the most fatalities of all. And each of these both appear to be impervious to, not impervious, I should say, but very resistant to the vaccination. So my points is kind of 2. First of all, I think that people don't give the people who are sick the credit they deserve for, being able to beat the disease. And second of all, with these variants all coming at one time, I'm not really sure we should be opening the school in the first place. Sorry if that was a bit unorganized, but I had to do it off the top of my head because I was expecting my notes.
All right, thank you.
Else? Do I still have any time left?
You have 1 minute and 11 seconds, 10 seconds.
All right. So I think about it just a second. Okay. So with the immune response, we've beaten several pandemics in the past. It's not like this is a new thing. So now that we have the vaccine, people are going, well, let's completely disregard the immune response. So I'm thinking, as a person who already survived the pandemic, I don't want to put myself through what people are going to go through. I remember a couple more things. One of them is there's a doctor, I forget his name, but it's on my list of things. And he takes blood smears, and he's shown the blood smears of people who are vaccinated are very abnormal compared to a normal blood smear. And there's one more that I just thought of. I can't remember right now. Let me think. I can't remember. Sorry, but there's something else like the blood smear thing where you'd be like, wow, I didn't know that. Sorry, forgot.
All right, your time's up. Thank you for your comments. Sorry, this thing. excuse, Jennifer, who is our next speaker?
Kenneth Fitzpatrick. Just
I'm
one
sorry,
moment.
I'm jotting down the names. Hold on one moment. What was that name again?
It's Kenneth Fitzpatrick.
All right, Mr.
And
Fitzpatrick, you have, I'm sorry, Jennifer, I cut you off.
I was struggling to unmute him, but he's good.
Okay, Mr. Fitzpatrick, you have 3 minutes. Is he unmuted?
He's able to talk, yes.
Good. How about now? Can you hear me now?
Yes.
We can now. You have 3 minutes.
I would like to express strong opposition to the board's potential consideration and approval of this resolution for several reasons. I know of people who have been vaccinated and have had some incredibly bad side effects. One person's had uncontrolled breathing or bleeding. They've not been able to stop it. Another person's had excruciating pain in their joints. And then one of my best friends, 55 years old, perfectly fine before the vax, got the vax, was dead within 24 hours. So there's more than just one side to the story. These vaccines are under an emergency use authorization only, and regardless of what the good doctor said, they have not been proven as safe and effective for a long-term study. There are many side effects that we do not know about yet. Requiring, as the district, our students and our staff to be vaccinated for an experimental thing seems to me to open up the district to enormous liability and possible workers' comp claims and a lot of adverse reactions for our students. Many of the students I've talked to have no interest at all in taking the vaccine. When I've asked them, would you come back to the college if it was required, they have told me no. This goes back to the core of our college mission. It's to educate students. It is not to require them to be vaccinated. Furthermore, if the vaccines were that effective, why are these new variants reinfecting those who have been vaccinated? That does not seem to make sense to me. If you look and you do some research on the number of actual deaths reported on the open VAERS system maintained by the CDC, the last number I saw was in excess of 12,000 deaths related to the vaccine within 3 days. You have to search to find this information, but it's out there if you're willing to look for it. In 1976, we tried to mandate a swine flu vaccine. It was stopped when we had 25 people dead. So as far as the breakthrough cases and the great rise in the number of cases, Fauci himself said last year that any case, the PCR test is not valid above 27 cycles for anything. We're running the cycles up to as much as 40 cycles. The CDC just rescinded their emergency use approval for the PCR test. So when you talk about a case, you're talking about meaningless information because the inventor of the case, Kerry Mullis himself said that the PCR test cannot be used for diagnostic purposes. It can only be used for laboratory generation of sample sizes. So I am strongly opposed to this. Some of us have health conditions that preclude us from being vaccinated because of potential blood clots. And you're going to open yourself up to tremendous adverse harm for our students. Yes,
Thank you,
there is maybe
thank you, Mr. Fitzpatrick, for your time. Your time is up. Jennifer, if you could invite the next speaker. And let me also, I neglected to mention, when you introduce yourself, please let us know whether you are faculty, staff, or student, or a member of the public. That's quite helpful. So Jennifer, our next speaker.
David Lockwood.
Welcome, Mr. Lockwood.
Thank you for giving me a moment to speak. My name is David Lockwood. I'm a staff at Los Rios Community College District. I'm here to express my strong opposition to the vaccine requirement. And there's a couple of questions that I hope could be answered. One of them is, what are some of the exemptions if the vaccine would be mandated by the district? What matrix is Los Rios using to determine emergency status? Because before it was ICU beds, and currently CDC says that only 8.7% as of today of the ICU beds in Sacramento County are actually filled. And the reason I'm asking this is because The EUA approval means that it's a voluntary vaccine under emergency circumstances. So what matrix is Los Rios using to determine that it's an emergency? And also, because it's EUA approval, will the district accept responsibility, because we as people have to release liability from these vaccine companies? Will the district accept responsibility if there is negative reactions to the vaccine? And lastly, heart disease runs in my family. My dad has had a massive heart attack. My dad's dad died of a heart attack and heart disease. And actually, January of last year, I was temporarily, inconclusively diagnosed with congestive heart failure. And with that in mind, my dad's heart doctor has strongly discouraged him from taking the vaccine. Because there's no conclusive evidence, my doctor refuses to sign a doctor's note. But I don't want to take the vaccine, because if my dad's heart doctor says that it's dangerous for him and I'm in the same boat, I feel like this is quite concerning for me and for my health and for my future. And so I guess the last question is, will I be punished if I choose not to take the vaccine to protect my own health? Thank you.
Thank you. And I believe, I don't want to go into responding to each of those, but I know that we will present an overview in the discussion on what the parameters of that mandate is and what existing law exemptions are. So hopefully we will be able to address those questions at that time. So with that, Jennifer, who is our next speaker?
Matthew Battershell.
And make sure you all introduce yourself and let us know from where you come. Matthew, welcome. Is Mr. Battershell unmuted?
Yeah, can you hear me?
We can hear you now. Welcome.
Thank you very much. My name is Matthew Battershell. I've worked for the district 15 years, and I'm a web developer at Folsom Lake College.
Thank you.
I strongly oppose a mandate for this vaccination, and I'm going to go through why. First of all, Dr. Glenna brought up about measles. In the 1920s, this is from the CDC, measles had a death rate of 30%, and one dose of the vaccine MMR is 93% effective. We go to COVID-19, less than 4% mortality rate with comorbidity rates included. And now we have, as Dr. Glenna admitted, with the Delta variant, our vaccines are far less effective. Israel has been one of the first to study, test, and use the Pfizer and Moderna vaccines. CNBC just reported they are in the low 30 percentile effective against the Delta variants because of that spike protein. Pfizer's CEO just came out and said you'll need a booster shot after 6 months. As another gentleman said, according to the VAERS report, we've had 12,000 deaths in America. Just so you know, that is more deaths than any vaccine in American history. Of course, we have blood clots, heart problems, inflammation. July 29th, the CDC's own internal document, the 28-page PDF, states this: 15.1% of new deaths between April and May were in vaccinated people. And of course, Dr. Fauci came out 2 days ago, and this is a study that was done in Massachusetts. The AP News came out and said this, that those vaccinated carried the same amount of the coronavirus as those unvaccinated and had the same ability to spread it. We're talking about the same ability. So my conclusion is this: why should the district mandate a vaccine that has high death rate, more than any other vaccines, a low effective rate in curing or preventing COVID, and now with the Delta variants has the same ability to spread it as those who are not vaccinated? We're going to have lawsuits. In fact, I was looking at the board docs there. Right now, CSUS is in a lawsuit because students are suing with them forcing students to go get a vaccine. And this is in court and they are hearing the case. So we'll see how that case comes. But the board needs to be ready for lawsuits. If someone dies after this COVID vaccine that's not as tested as people have said, because it's an emergency, not FDA approved.
Thank you for your time. Your
Thank you.
3 minutes is up. Thank you so much. Thank you. All right, next speaker.
Teresa Aldrich.
Welcome, Teresa.
Good afternoon. Can you hear me?
We can hear you, yes.
Okay, great. Good afternoon, Board President Ortiz, Board of Trustees, and Chancellor King. I am Teresa Aldridge. I am commenting as a resident of Davis in Area 4 of Trustee Wilkerson's region. I'm proud to have her as our trustee. I'm a 29-year faculty member of the Los Rios Community College District. I want to applaud the board for taking this important action in this much needed next step in the fight against protecting our faculty, staff, and students from this unseemingly unending COVID-19 pandemic. How can we ignore the loss of life of over 64,000 deaths in California and over 600,000 deaths in the nation? I wish to strongly urge the board to take action that would allow everyone to feel safe returning to the college by requiring that everyone, all faculty, staff, and students be vaccinated if their physical presence is required on the college campus, and to implement this requirement effective as practically possible during the fall semester, and to not delay this requirement for students who will physically need to access the college campus. Please keep all of our employees safe. Thank you for your time and service to the district.
Thank you for your comments, Teresa. Jennifer, the next speaker.
Allison Smith.
Welcome, Allison. Allison, are you unmuted?
Yes, now I am.
Okay.
Good afternoon. My name is Allison Smith, and I'm calling from San Diego. And the reason that I'm calling in is because I have young nieces, one of whom is in a community college district here in San Diego, and another one who is due to start at San Diego State next month. And I am extremely concerned about vax requirements for my young nieces who aren't even 20 years old yet, because of evidence that these experimental vaccines can affect future fertility and that they concentrate in the reproductive organs, such as the ovaries. And they're just simply still experimental. They should not be mandated to anybody, students, faculty, administrators, to anyone. I'm sure you guys are aware of the Nuremberg Code that says that people should not be forced to take an experimental treatment against their will. And I agree with many of the things that Kenneth Fitzpatrick just said. You talk about the breakthrough cases. Just today, Lindsey Graham, one of our United States senators, is reporting that he's been fully vaccinated and yet he's had a breakthrough case. So by forcing people to be vaccinated, it may be more dangerous than having unvaccinated people on your campus. The mRNA technology floods the body with the spike protein, and we don't know enough about the long-term effects of that. Even the inventor of mRNA technology, Dr. Robert Malone, is seeing problems and has been talking about the problems with these so-called vaccines. And where's the test for the Delta variant? I don't know how they're calculating Delta variant cases, because as far as I know, there's no test for it. So if the vax works, why would you worry about having unvaccinated people on campus? And if the vax doesn't work, why would you want to require anybody to take it? So my final comment is, you've got to stop trampling on people's freedom to make their own health decisions. Err on the side of freedom or promote freedom. Do not promote tyrannical forced vaccinations. Thank you.
Thank you. Next speaker, Jennifer. Let me just do my timer, get my timer ready. Jennifer, next speaker.
Halen Christine.
Is the last name Christine or what was the name again?
It was submitted as Kaylin Christine. Talking is permitted. She's on mute.
You've got to unmute yourself, Kaylin.
Hey there, I apologize. I was having some technical challenges, but I'm here just as a representative of the public, and I just wanted to make just a couple of quick comments. I appreciate everyone's time and joining in on this very informative meeting, but I do greatly oppose this mandate to vaccinate and require that, as someone that does have health challenges, and particularly as someone as actually a caring mother. I was actually considering joining school this fall, and I will not be able to if that's going to be something that's mandated because of the lack of information and the test of what this could do from a future perspective, especially considering that this is still something that's only authorized for emergency use. So I'm still just trying to receive quite a bit of knowledge from this this meeting and gathering here. But I just want to say everyone has a different walk of life, and I believe we're all still waiting on more signs and more knowledge and data, just so that people can make informed decisions for their personal health. So thank you very much.
Thank you for your time. Next speaker, Jennifer.
It's Maria Lope or Lope, and there are a few Marias without last names, so I hope I unmute the correct person if you can let us know.
Maria Lope. Maria, if you unmute yourself, you can have 3 minutes.
I see another hand up. Let me try. Give me one moment.
Yeah, it's the Maria also says she's Maria Lope. I can see that. So it really is Maria Lope that she's in the queue. And we'll give you a couple seconds, but we really need to move forward.
So I have two Marias here. I'll just go ahead and all three of them can, okay, there we go.
Okay, here I am. Sorry about that.
That's okay.
Good afternoon. I would like to bring a few points. There was some good ones already up. Yes, there has been over 12,000 COVID vaccine recipients have died. That's after they got the COVID vaccine. 336 of those are from the age group 17 to 44 years. 336 people from 17 to 44 years have died after the COVID vaccine.
You may continue. Have you muted yourself again?
Okay. Also, I want to let you know that Pfizer, who is one of the vaccine manufacturers, has said alongside vaccines, success against COVID-19 will require antiviral treatments for those who contract the virus. I have a feeling that they're saying this because the CDC has said that the virus is mutating quicker in vaccinated population. The vaccines are becoming, they're not even becoming helpful because it's vaccinating so much after the virus. CDC said the vaccinations may not be effective, and also the communicability is increased in the vaccinated versus unvaxxed population. And another thing that I pulled from the Pfizer website is, guess what? They're initiating a phase 1 study of novel oral antiviral therapeutic agents. The same things that they shut down in order to get this emergency use authorization for the vaccines, they are now working on, and they are now going into studies for. They shut down ivermectin, and and hydrochloroquine. So now they're doing their own antiviral therapeutic agents. Isn't that something? And I haven't heard anything on the news about that. You know why? Because they want people to get vaccinated still. It's a big moneymaker. Pfizer has made billions and billions of dollars in this last quarter. Thank you.
Thank you. Jennifer, next speaker.
Sophia Nuna.
Sophia, you may begin. Sophia, have you unmuted yourself? Okay, we need to move along. So unless we hear from Sophia, like right now, we need to move forward. All right, the next speaker, Jennifer.
Okay. One moment. It's going to be Martha Goff.
Martha Goff, welcome, and please identify yourself if you're a faculty, staff, student, or community member.
I am, my name is Martha Goff. I'm a 22+ year classified professional at Sacramento City College. And before I say what I was going to say, I just want to point out that while we're sitting here, it just came out in the New York Times that the FDA is now planning to fully approve the Pfizer vaccine by the start of next month as a new surge of infections grows. So
Thank you for that.
The concern about it being not a fully approved medication, I think is going to be dispelled very shortly. I am speaking definite strong in favor of this mandate. I am a little bit older, and as a classified professional, I do interact with a lot of people. In addition, I'm concerned that the population that mostly attends Los Rios colleges is 18 to 24 and or people of color, which I believe are the demographic groups that are less likely to be vaccinated. I was hoping the doctor would still be on so that she could confirm that, but she's gone. Secondly, the president of Sacramento State, which is Robert Nelson, sent out a very detailed letter to his employees at the campus describing a very precisely outlined program for when they have to be vaccinated, how they're supposed to report it, and so on. And I forward that to Chancellor King in the hopes that something similar would be adopted for Los Rios. In addition, Sac State has vaccination clinics on campus every single day that have been in operation for months. And I strongly encourage the Los Rios board to set up something similar at the Los Rios campuses. Thank you.
Thank you so much, Martha. I appreciate your time and attention to this. Next speaker, Jennifer.
Michelin Scarlatelli.
Hello, can you hear me?
Yes.
Hello, good afternoon. How are you?
Good, thank you.
Good. My first question is, where did our constitutional rights go? This vaccine, I'd like to express strong opposition to the vaccine passport. It's how is it legal to mandate an experimental vaccine without full FDA approval? Can you actually state the law behind this mandate? The pharmaceutical companies have no liability to you at all. Does the school accept all liabilities while mandating this? There's been 12,000 deaths related to the vaccine. The vaccinated are shedding spike proteins. So why are you pushing it? It seems as if they're a vessel for infection. You state this is an epidemic of the unvaccinated, which is a lie and it's fear mongering. How is it possible to mandate when you have no idea what this vaccine does in the long term? No one does. You don't have the authority to mandate an emergency use approval. You're comparing this vaccine to the measles vax, which was FDA approved. So it's comparing apples to oranges. There's no comparison. If the vax works, why are you so worried about the people that choose not to take the vaccine? We do live in a free country. Remember that. Where are all your studies and data? It seems like you guys pull it out of the air when it's, whatever you need, you just decide to say. I would like a full copy of all the data and all the studies. The PCR tests that you're referring to that are showing all these cases have been pulled by the FDA. I know other people have said it, but I want to say it too. These tests have been recalled due to the fact that this test does not differentiate between flu, COVID, cold, etc. And you keep speaking of a Delta variant. There is no test for a Delta variant. So variants are just a bunch of BS. Masks are not effective. You can read Fauci's emails to find that out for yourself. Have you ran any tests in your in on masks? Do you understand there's bacteria growing on masks and that causes sickness and illness and it also hurts your immune system? The variants are a farce. There's no test and it's a lie. Have we lost our HIPAA rights as well? Do we not have a right to privacy anymore? I mean,
Comments, your 3 minutes is up. Thank you. Next speaker. Jennifer?
I think you just hit that button, by the way.
No, your 3 minutes is up. Welcome, Jennifer, next speaker.
Afton?
Hi there. Thank you for having me. I'm a member of
We can't hear you. Could you speak up, please?
Hi, can you hear me?
It's a little blurred. Like you're in a tunnel.
Oh, it's because I'm using my computer.
Okay, well, let's go ahead and not use up your time, but go ahead and begin.
Okay.
And if you could identify yourself, if you're an employee or member of the public.
I'm a member of the public, and my name is Afton Virgiano. I just wanted to reinforce, I got cut off on the call. I didn't get to hear everybody.
Please proceed. We can't hear you if you're speaking. I think we're having technical difficulty.
But science and questions, and okay, yeah.
We can't hear you, Afton.
Oh, sorry, my internet is bad. Can you hear me?
Yes, please proceed.
But basically, the death rates are lower than ever right now for COVID. The death rates haven't been this low since the beginning of the pandemic. I don't know anybody who got sick with COVID. I do know 3 people in the hospital with blood clots from the vaccine. The CDC is being sued for 45,000 deaths. And then we can look at Sweden. In Sweden, nobody has died from the virus in 7 days. And only 7% of the population is vaccinated in Sweden. So if you look at things like that, I know it's hard to hear me. I won't take too much more of your time. Dr. Robert Malone is the inventor of mRNA vaccines. He is warning people to stop taking the vaccines. If he is one of the scientists that created it, and he's saying, please stop these programs, I believe you should listen to all the scientists, not just the ones that you like to listen to. And do not mandate the vaccine for students or faculty. It's unacceptable. Thank you for your time.
Thank you. Jennifer, the next speaker.
It's John. I apologize for the pronunciation. Coctiston. They are permitted to speak.
John?
Yes, I'm sorry. Yes, I'm here.
Okay, please begin.
There were just two simple questions that maybe you guys could take offline. I'm not going to bother you with all the other items, but will the university be accepting liability for any of the side effects in lieu of the PrEP Act, the federal PrEP Act, is the main question. And I guess the other one just ties into that. And on the tests that you guys are using in lieu of the vaccine, if you allow for a addendum or a what's the word, a pass on the vaccine, what kind of testing schedule would the university be using or the college? So the two questions again are, will the university be accepting liability for any side effects in lieu of the PrEP Act? And what type of testing would the university schedule for people that cannot take the vaccine? So hopefully those answers could be given by the board. Thank you.
Thank you. And John, just for identification purposes, are you an employee, a student, a staff, a member of the public?
Student.
Got it. Thank you for that. All right, Jennifer, next speaker.
Veronica Sullivan.
Up there, you gonna read it?
Hello, can you hear me?
We can hear you.
Okay. I just want to say, my family strongly disapproves of the vaccination, or the vaccination passport to be on campus, right? So besides the fact that it is unconstitutional, it violates our Fourth Amendment because our body is our property and nobody can tell us what to do with our property. And it's also a violation of our civil rights. It's still America, not Germany. And our whole family just caught the Delta variant from someone that had the vaccination from the shedding. That was our property in our country. And we follow what Dr. Marty McClary from Johns Hopkins said, that the doctors and the media are not following natural immunity and catching the virus and surviving it. The natural immunity is 19 months versus 6 to 9 months maximum with the vaccine. Also, the side effects from the vaccine, boxer Marvin Hagler died from getting the vaccine. Baseball player Hank Aaron died from getting the vaccine. Numerous people even at my mom's work are dead after getting the vaccine. So we strongly oppose the vaccine mandate passport.
Thank you. I appreciate that. Okay, Jennifer, next speaker.
So the next one is Jennifer Campbell, but it's another instance where there are multiple user names. So I'm just gonna try, there are like 4 or 5 Jens.
Okay, so we have one Jennifer Campbell that is in the queue. So Jennifer Campbell, if you could join us and again, let us know if you're an employee, a student, or a member of the public at large. No Jennifer Campbell? And you've opened all the Jennifers, right, Jennifer?
Yes.
Okay. All right. Well, since we don't have a Jennifer coming forward among the several, let's move on to the next speaker.
Okay, and this is going to be another example of, I think this is the right one, David B.
David B., you are up, and please make sure you identify yourself as an employee,
Hi.
member of the public.
Certainly. Can you guys hear me okay?
Yes, perfectly.
Okay, thank you. My name is David. I am a member of the public. I have myself caught COVID. I spent 9 days in the hospital with pneumonia from it. I understand that it can be a serious disease. I've taken vaccinations in the past. My wife, my children have all been vaccinated, and I have a son who is of college age right now. I actually had questions more around what the doctor had said tonight, especially regarding the comment on to put a stop to the spread, we must vaccinate. How does that mesh with the comments that the vaccinated were shedding as much as the unvaccinated, or vaccinated were carrying the disease as much as unvaccinated? she also made a comment about polio, a comparison to polio and measles vaccines, which I think someone mentioned earlier. Those were FDA approved vaccines at the time they were pushed out, versus this one, which has not been. Somebody mentioned along the lines of the approval, full approval, that the New York Times had put out a story, but the doctor also said that it takes more than a year of following someone around, following test subjects around before it can get fully approved by the FDA. Is this a special case again? Is this something different? People have mentioned the VAERS database of deaths more than any other vaccine in the history of the country. And I don't know that anybody's mentioned this yet, but that I don't believe we've ever in our past asked or forced someone to get a vaccine who has been infected and recovered. So I don't know that we know the impact of this. If you got the measles, you were not asked to get the measles vaccine afterwards. If you got chickenpox, you were not asked to get a chickenpox vaccine. As you can probably tell, have concerns, strong concerns about this. I have strong opposition to mandating it, but I think it should be everyone's choice how they decide to take this vaccine or not. If masks are effective, why can that not be an option instead of fully mandating a vaccine? If masks are not effective, then got a whole different problem. So I urge your board to really consider the different options here and consider those who have been previously infected and recovered, those who do not want to take it for religious reasons, and other mitigating steps that you can take other than forcing a vaccine upon people who do not wish to take it. I appreciate your time tonight. Thank you.
Thank you. So Jennifer and my colleagues and our legal counsel can weigh in if I'm off track, but since we actually have the discretion to limit public comment to a minute, since we have 120 speakers in the queue, let's go ahead and going forward, our speakers will be allowed to, let's see. Okay. Let me ask for guidance from our legal counsel, what our options are to ensure public comment and engagement and balance that against the need to make sound public policy and perhaps even address some of the questions that have been raised. Legal counsel, could you weigh in on our options?
Certainly, President Ortiz, thank you. Yes, under California law, the Brown Act or Open Meetings Act, the board does have the authority to adopt reasonable regulations, especially if there are particular items with so many public commenters that it would make it so that the board doesn't have an opportunity to get to the business of actually discussing and making a decision. So options that could be presented to the board include under our current board policies, the Board of Trustees may limit the number of speakers who appear before it in opposition or in support of a given issue being considered by the board. The board could consider lowering the amount of time given to each public speaker. The board could also set an overall general time limit, a number of hours as an example, that public comment will be heard. But at some point, the board does need to have the opportunity to get to the public's business.
So with that, I am going to allow, and I'm going to need help with the time limit, 2 minutes for each speaker, and let us spend up to 45 minutes. And for those speakers that are already in the queue, you've given your name to our clerk. We will allow you 2 minutes, but in 45 minutes, we will move on to presentation of the item, as well as deliberation of the trustees and action by the trustees. Will that pass legal muster or legal counsel?
There's certainly precedent for lowering the time for each speaker to 2 minutes, and there is again authority to the board to limit the number of speakers overall. So if it's the board's pleasure that the board has received and has received an understanding of the public's input after 45 more minutes, I believe that would absolutely pass legal muster.
Wonderful. So let's move on. Going forward, speakers will be given 2 minutes And it is now 5:14. We will move into action and presentation of the item at 6 p.m. So let's go ahead and invite the next speaker. And again, 2 minutes. The less time you use, the more people can speak. But we are cutting off public comment at 6 p.m. Next speaker, Jennifer.
So it's either, there are two names, Stan Deland, excuse me, is the screen name, and the name submitted is Michael Gonzo.
Okay, Stan or Michael Gonzo, if you're the same person, you are up and you have 2 minutes. Okay, let's move on to the next speaker since we don't have them coming forward and we want to ensure as many people as possible in the time we have left. So who is after Stan / Michael Gonzo?
Teresa Lopez.
Didn't she just speak?
Hello. No, I did not.
Teresa Lopez, welcome.
This is Teresa Lopez. I'm an employee of the LRCCD. And I think that I'm really strongly opposed to mandating it. I believe people should have the choice to, because there are a lot of people that feel uncomfortable, whether it's because it's not FDA approved, that they know people that have had severe reactions or died, that they've had, the vaccine has had effects. And I mean, that they've had that they've had COVID, and they're concerned that if they take the vaccine on top of that, that they will lose the immunity that they've already gained through having COVID. And then I went to a CDC site and found some numbers that I would like to speak on. And there's nothing in the chat, so I'd like to put the site in the chat so people can look it up for themselves to see if what I'm saying is true or not. But the numbers that the lady presented before, she was talking about that these were rates for people that had COVID. It was like 16.7 people per 100,000. And she was talking about it's not just death rates, but long-term effects, right? Well, according to what I found, the death rate of COVID is 1.7%. The death rate of the vaccine is 1.22%. That is extremely close. Okay, so now the long-term effects were she was talking about this is 16.7 people that get COVID per 100,000. For the CDC site that I found, these are the results from the vaccine. Bell's palsy is 1 per 200 people. Blindness, 16 per 1,000 people. Cardiac arrest, 2 per 1,000 people. Cerebral hemorrhage, 1 per 1,000 people. Deafness, 2 per 1,000. Facial paralysis, 1 per 200. Inability to walk, 1 to 400. Shingles, 1 per 100.
Your 2 minutes is up. Your 2 minutes is up. Thank you, Teresa.
Thank you.
Next speaker, Jennifer.
Dawn Barry.
Hi, my name is Dawn, and I am making a public comment in strong opposition to mandating an experimental vaccine. As I said, it's not only unconstitutional, but a war crime under Nuremberg Code. You talk about the numbers of people who died or have been hospitalized, yet the FDA has come out to say the PCR tests are unreliable, and that the CDC had come out and said that they were putting people under COVID deaths when they didn't necessarily die from COVID. They just had COVID at the time of their death. So the numbers are extremely skewed and nobody is talking about it. Information is being shut down. Your health advisor also talked about the polio vaccine, yet she left out all the casualties from that vaccine. In 1955, 200,000 children were given this vaccine. 40,000 cases of polio came from that vaccine, leaving 200 children with varying degrees of paralysis and killing 10. We already know that 45,000, and that is a small amount, have already died from this vaccine. The CDC is being sued over this. We have whistleblowers coming out constantly saying how horrible this vaccine is. There are okay, the vaccine has created blood clots, inflammation, Bell's palsy, inflammation of the brain, infertility, miscarriages. CDC states that 74% of the new cases, this Delta variant, are coming from the vaccinated. So what would make you want to vaccinate more people? And COVID-19 was very susceptible to older people, barely touched the younger people. But this Delta variant is actually affecting the young people. And you want to vaccinate more people? Like
Thank you for your time. Your time
You're
is
welcome.
up.
Thank you.
Next speaker, Jennifer.
Stephanie Smitherman.
Hi, can you hear me?
I can hear you, Stephanie.
Okay, thank you. So I'm a student actually, and I strongly oppose mandating this experimental vaccine or any medication. Having obesity increases the risk of severe illness from COVID-19. People who are overweight may also be at increased risk, since obesity may triple the risk of hospitalization due to a COVID-19 infection. Why are we not fighting obesity and encouraging better health choices to promote long-term immunity against current and future viruses? The Rio Grande Valley sector detention facilities now account for 60% of all detainees confirmed to have COVID-19. There are reports that Border Patrol is not testing all migrants for COVID before they're released across the US border, much less vaccinating illegal immigrants. So how can you force vaccinate US citizens when the current administration is not closing the borders to protect its citizens during a health crisis? There is no true Delta variant testing system, and the PCR tests are found to be unreliable. So it seems impossible to rely on any data regarding an uptick in cases provided here today. Lastly, as previously mentioned, mandating this vaccine is unconstitutional and violates my body, my choice. Thank you.
Thank you. Next speaker, Jennifer.
Trajan Robinson.
John.
Hello, sorry, my name is Trajan Robinson. I'm a student at Folsom Lake College. One moment. I'm a student at Folsom Lake College, and I'm also a student leader where I serve as the acting president of the Associated Student Senate. I strongly support a mandate for vaccinations, as they have been proven to be effective at preventing the contraction of COVID-19 and similar variants. We see that similar college systems such as the CSU and UC system are adopting similar mandates, and the UC system did so in July before the spread of the Delta variant. One second. We know that vaccines significantly reduce the chance of contracting COVID, but they do not cure or completely prevent getting COVID. So there are breakthrough cases, but it is the best ones have about a 90% efficacy rate. And with, about 613,000 deaths from COVID-19 right now, and to just reflect on last year in Southern California, when ICU beds were at 0%, I don't see how there can't be a vaccine mandate. And just for students, we've been remote for a year, and we need to get back in person. I recall when we first locked down due to COVID, the amount of students that dropped out because of it. It's been very difficult on all of us, and I can't see us staying virtual for another year. It's nightmarish in a way. My public comment is over. Thank you.
Thank you so much, Trajan. We appreciate that. Next speaker.
Tony Cartwright.
Tony, you're up.
Thank you very much. Can you hear me okay?
We can hear you.
I just had a simple question. Will the students or potential students be denied access to the campus and perhaps by extension to their education if they don't participate in the vaccine program? And secondly, if any employee wishes not to take the vaccine or participate in the vaccine program, will that employee be fired, or there be reasonable accommodations made for such employees? Thank you very much.
Thank you. And I think will be addressed many of these will be addressed in our presentation, but thank you.
Thank you.
Next speaker.
Rob G.
Yes, I'm here. Can you hear me?
Yes, we can.
All right. I'm a community member, citizen, and I just had a couple of points to make. One is that there's actually a legal issue with mandating an experimental vaccine, and until the vaccines are receive full FDA approval, it's federal law 21 USC code 360 BBB E. I'll spare you the rest, but you can look it up. Also, another question I have is if the vaccine works, why is there a concern for those that choose not to receive the vaccine? Why would it be a concern if it's so effective for other people? Now, we know that the efficacy of the vaccine is questionable and unproven. The long term side effects have not been researched or studied because there's no long term studies on them, considering we're in the middle of a pandemic. However, a lot of people would prefer to work on their own immune systems and trust in therapeutics rather than a vaccine. And I don't see how the government has the authority to transgress that right. Also, my other question would be in a school setting where most of the students are younger, and we know the mortality, morbidity rates for the vaccine, for the COVID virus are actually lower than the flu, unless you get up over 50, 70 years old. My question would be, are we then going to mandate vaccines for every other disease that has such a overwhelmingly low mortality rate? And I frankly find the behavior of boards like yours pretty disgusting. It's authoritarian and it's not in line with the science in any way, shape, or form, but it is in line with control. So I'd just like to give it back to you. If you could address any of my questions, I would much appreciate that. I am a proud boy. Hooroo. You guys have a wonderful day.
Your time is up. Next speaker, Jennifer.
Crystal Baham or Baham?
I'm sorry, how do you spell that first name?
Crystal Baham, can you hear me?
We can hear you, Crystal. Please begin.
Yes, all I just wanted to say is that I strongly oppose moving forward with requiring students to be vaccinated prior to in-person instruction. And that is all that I have to say. Thank you very much for your time.
Thank you for being brief. That saves time for other people. All right, next speaker, 2 minutes. But we are going to wrap up in 18 minutes.
Some of our people have left, so I apologize. I'm just looking for the next. Okay, here's one that's here. Nicole Williams.
Nicole, you're up.
I'm not Nicole Williams. I'm not sure if you have the one Nicole, but take it.
Thank you.
Is there a Nicole Williams? And Jennifer, are you able to figure out which one to?
She got it. Hi, everyone. My name is Nicole Williams. I am at Sacramento City College as a classified professional. And I think I might have a slightly different viewpoint as somebody who is vaccinated and got vaccinated during pregnancy, which seems to be of great concern for folks here. I can understand the concerns that we have, but my biggest concern is our students who are of our Black and Brown students who have a different distress for the medical community as a whole. I do hope that that part is going to be really our focus and us remaining student-centered as we are going through this process. Thank you.
Thank you for your time. All right, next speaker, Jennifer.
So the other Nicole also had her hand up, so I apologize for cutting you off, but you're now live.
No worries, I'm here, and thank you for your time.
Oh.
Go ahead and continue, Jennifer.
That might have been my fault. I'm sorry. There you go.
I can hear you.
I do want to keep this quick. I'm a member of the public. I do strongly oppose this, and I do feel that other arguments that I've heard so far in opposition sum up how the majority feel, whether each of you personally do or not. This is going to segregate people of color most of all, so I hope that people that are on board with this are okay with that. And then lastly, I just want to say, Mr. Jamie Nye, you appear very arrogant by being on your phone the whole time, ignoring each one of these speakers. Thank you. I yield my time.
I ask you to be respectful of our staff. You have no idea what they're doing. So if you could wrap up your comments, I'd appreciate that. Are you finished, Nicole? All right, let's move on. Jennifer.
Andrea Cedillo.
Andrea Cedillo, you are up.
Hi, thank you for allowing me to speak at this board meeting. I am a community member in California, but I work in higher education and I've been at home for a year and a half plus. My concerns are that you guys are pushing a vaccine that's not FDA approved. There's been many deaths, and I agree with everyone opposing the vaccine. And I want to read a comment from President Biden that recently warned people who are not fully vaccinated against COVID-19 can still die every day from the infection, adding, "This is your choice. It's life and death." So why are we pushing a vaccine to the children, the kids, the students? Let them get their education. We have a child that just graduated from, thank God, a Christian high school, because we all know this is political. I won't even allow him to go to higher education because this is not okay what you guys are doing. It's tyranny, and we have a constitution to uphold. So I really pray that you guys will do the right thing and show some emotion. These board members are very, very emotionless, and it just kind of proves exactly what the backstory to all this is. So my concern as a parent and an employer, somebody that's employed with higher education, is this must stop. It should not be mandatory. It should be up to the person, my body, my choice. And you guys should stop pushing fear into the students, staff, and faculty, because we are a community in California and this is all political. So this should already stop. And if people are vaccinated and they're comfortable, go out. The people that are not vaccinated, they should be able to go out as well, because it's a God-given right to have a vaccine or not. And too many people have died for this. So everyone that's passing this is tyranny. And I'm sure you guys will know you're going to have to accept the consequences. So again, if you are pushing the vaccine and if you're vaccinated and you don't want to be around people that are not vaccinated, maybe you guys should stay home and have the people that are not vaccinated and healthy.
Thank you for your time, Andrea. We appreciate it. Next speaker.
Man, shit.
Nicole Pearson.
Hi, my name is Nicole Pearson. Can you guys hear me okay?
We can hear you.
Okay. I'm an attorney, so I just like to give a little bit of advice that people have already done a very thorough job of articulating all the problems with these vaccines. They're not authorized, they're approved, they cannot be mandated. You must be to give informed consent. An alternate situation or scenario that I wanted to propose was this. Now that we know that the vaccines don't work at preventing contagion and preventing transmission, I'm actually having a lot of businesses, including universities, coming to me asking me how to protect their unvaccinated staff, faculty, and community members from vaccinated individuals who now can contract the virus and transmit it without even knowing. I'm wondering if your true goal and concern is the health and safety of your community, how you guys are letting and prioritizing individuals to have access to an education, to facilities, to all the opportunities when they actually might be spreading the disease unknowingly. An alternate situation in a free democratic American society is all adults take responsibility for their personal decisions. And if you're truly concerned about the health and safety of your community, including your own liability, is to have these adults sign waivers that they come to school, they accept the consequences of being vaccinated and spreading it and contaminating their community, or being unvaccinated and spreading or contracting or whatever the case may be, because they are on equal footing now that we know per the CDC, and having individuals, these adults, sign a waiver of liability. If you truly want to have a free and open democratic society and university that prioritizes First Amendment rights to assemble, this is the alternative. That's the alternative you should be pursuing.
Jennifer?
Mimi Ortiz is next.
And, I want to remind the speakers, I don't like cutting you off, but 2 minutes is 2 minutes, because we do want to get through all of the people who are trying to speak. So Mimi, if you may begin. Mimi, are you unmuted?
Hi, sorry. Yes, I'm here and I'm going to be really quick because I didn't think I was going to get the chance to talk. I just want to say really quick that I don't even understand why we're having this discussion, because Education Code 220 prohibits any kind of discrimination. I don't think so many people realize in reality what the big agenda behind all this is. I think everyone needs to go to the CDC website and look up the shielding approach, which is going to setting up camps and eventually separating people. I don't understand how people are not seeing the reality of all this. Another thing really quick, it is unlawful to mandate any vaccine towards anyone. You cannot just force everyone to get a vaccine because you think it's going to save their life. Everybody has different DNA, different issues as far as health. And you just can't do that. You're going to be complicit to crimes against humanity. So another thing, one more last thing, and you guys can do this. Look up Ren's Law, the lawsuit, 45,000 death count from COVID shot lawsuit that was filed July 19th of 2021 in the United States District Court for the Northern District of Alabama. America's Frontline Doctors versus Xavier Becerra, Secretary of U.S. Department of Health and Human Services. It is all there. There is 67 pages of it. Look it up. If they're not being truthful with what they're telling us, we will end up in these camps, just like it says on the CDC. Everybody look up the shielding approach that they're doing, because we are going to be ending up like the Holocaust 2.0. Thank you for your time. And I really hope that you guys make the right choice and stand on the right side of history. Thank you.
Thank you for your time. All right, we now have the next speaker, Jennifer.
Joanna Sullis.
And if you guys could remind people, identify yourselves as if you're an employee, a student, or otherwise. Welcome, Jennifer or Joanna.
Thank you for your time. My name is Joanna Solis. I am a member of the public. I am strongly opposed against mandating the vaccine for all of the reasons that everyone who's opposed to it have mentioned. Last I checked, this was still the United States of America. This is not China. This is not any other nation where all their citizens have lost their rights. God does exist, and everybody will account to God when the day comes. Anybody who is taking away rights from the people, anybody who's forcing anything against their own bodily will answer to a higher power. And I encourage you all to remember that. Thank you for your time.
Thank you so much for your time. Jennifer, next speaker.
Krishna Murphy.
I'm sorry, what was that first name?
Krishna.
Krishna Murphy.
Yes, my name is Krishna Murphy. I am a member of the public, an elder, and a recent student. 10 years ago, I was in community college to get prerequisites in order to join professional training. And I believe that this is the most horrific excuse for a program in service of a dark agenda that I have seen in my lifetime. It is equivalent to the Nazi death camps. There are over 500,000 people, most likely, already dead in the United States. Over 50,000 that we know of for sure, as cited by the previous speaker about Mr. Renz's lawsuit. The Pfizer-BioNTech vaccine has an absolute risk reduction of 0.7%, and the Moderna vaccine has an absolute risk reduction of 1.1%. The other figures that you hear about are theoretical figures that should only be used among professionals. They should never even be mentioned to the public. What we have to deal with is a situation where we have a virus that is almost completely innocuous. Virtually no one dies from it. Yes, people are catching stuff. It goes around just like it did in prior years, and people who are already ill do die. But that is not the real nature of what is being presented to us. What is being presented to us is that there's this horrible disease that we have to worry about, that they trumpet 24/7 on all the media to raise fear. And the purpose has always been to increase the vaccine uptake.
Thank you,
And
Ms.
the vaccine
Murphy.
itself is much more dangerous than the virus.
Jennifer.
Candace Rios.
Candace,
Can you hear me?
we can hear you.
Okay, perfect. Thank you. Just two quick questions because I know you're short on time. What accommodations are going to be made for those staff and students that cannot get the vaccine for whatever reason? And will you also be opening up the medical records of every person on campus, faculty, staff, students, vendors, so that people on the campus can have some insight to other dangers we may be facing? We've got people who've got hepatitis and tuberculosis, which also spread really quickly. And I'm just wondering if we're going to have access to that information as well.
Thank you for your questions. And Candace, are you an employee or a student?
I'm a member of the public.
Got it. Okay, thank you for that clarification. Next speaker, Jennifer.
Rebecca Arnfeld.
Hi. Hi, can you hear me?
Yes, we can.
I am a faculty member at ARC. Thank you for letting me speak. I'm grateful to you for this proposal, which I think is a good step to secure our health and safety during the pandemic. As a teacher, I have seen far too many excuses coming from people's hospital admissions and even death certificates during this pandemic. So I am very aware of how this has affected our students very disproportionately. I'm really disturbed by the folks who have come into this discussion with their concerns, which I accept their concerns, but there's a great deal of misinformation out there. This idea that COVID vaccines have a high death rate is completely unsubstantiated. Even this number of 12,000, which is not an official number, really pales in comparison to the 4.21 billion doses that have been given worldwide. That misinformation about infertility caused by the vaccination is also something that's been debunked by a number of sources, including Johns Hopkins. So I just want to say that I hope the board will let science and medicine be their guide, not conspiracy theories. Thank you.
Thank you for your time and being succinct. Thank you. Jennifer, next speaker.
Keith Ellis.
Hi, my name's Keith Ellis. I'm a proud LRCEA member and employee of the district for the last 7 years, and I'm very in strong support of this proposal. I have faith that management will negotiate in good faith with our labor partners to the salient details and answer some of the questions that folks have brought up. And I would just throw out there, if you have to show proof of vaccination or a negative COVID test to get on a plane or to go to a bar or a restaurant, why not one of our campuses? Thank you so much.
Good point. And I appreciate that. And I appreciate your being succinct. With that, let's go to the next speaker, Jennifer.
Darla Cooley.
Hello, thank you for letting me speak today. I'll try to be brief. I am a nurse, over 20 years in the business. I'm a California resident. I've had children in the school system, college age now. I will just side with the people that have gone before me speaking against such vaccine mandates. Number one, okay, the science, obviously you folks, I can see what your agenda is. You know, the California keeps pushing this. It's all farce. You guys are not going to cover for anybody that loses a child as a result of taking the vaccine. So I'll just suffice to say that, you know, this is against our civil rights. This is against the Constitution, and you cannot force people to take an experimental vaccine. I personally have seen the injury and the death. Okay, so whoever that was that came out before me and said that there's no blah, blah, blah to the science, whatever, follow science, they're full of it. I am an actual nurse, and I gotta tell you, it's legit. You don't need to take the vaccine. You take your vitamin D, vitamin C, sunshine, and fresh air, and you will recover. There's too much death over this. Why are we subjecting our children to this? I'm very opposed.
Thank you. Next speaker.
Tony Boone.
Hello, can you hear me?
We can hear you.
Okay, I'd like to offer an alternative way to look at things, maybe as a medium side. You have to consider the misinformation coming from both ends. There's a lot of people afraid right now. Myself, I'm a veteran. I'm a member of the public, by the way. I'm adopted, so I don't know my actual medical history. My adopted parents weren't able to get that. So, I'm concerned about getting it because of any possible medical conditions that I might have. And I work for the Department of Veteran Affairs, and they're telling me that I may, if I don't get vaccinated, I have 8 weeks to do so, or I'm going to lose my job. And as a sole provider of my family, I don't think that's fair. You're putting students in a position, your staff. I understand the whole pandemic. It is a real thing. As far as the vaccine, who knows? But with this decision you guys are going to make, you have to consider both ends. There's scared people out there. There's people in my situation that don't know their health history and maybe putting ourselves in a bad position. Have I known what my medical history is, my doctor could advise me against it, but I have no idea. So that's why I would like to add, and thank you.
Thank you so much for your time. With that, Jennifer, the next speaker.
Marie Smith.
Hi. So I'm really struggling with this conversation because I'm having to slap myself just to, think through, am I in the United States of America? Did I end up in China? It's just a really bizarre conversation. I find it disgusting that I even have to call in and make these comments. But, number one, if you're scared, stay at home. Number two, how would you feel if I forced you to take an antibiotic so I don't get strep throat? Strep throat is contagious. Number three, whatever happened to my body, my choice? Or does that only apply to abortions in the state? FDA approval of this vaccine means nothing to me. Whether it's approved or not, it's my body, my choice. I'm calling in as a mother, just so everyone knows. There's no data to even support anything that you guys are doing. I want to understand what you guys have if I'm going to attend this campus or send my child. Ebola, herpes, where does this end? Tuberculosis. Why don't we just do a full-blown analysis of what everyone's walking around with and vaccinate everyone for every single disease that we know out there? I will work with a lawyer and sue if it comes down to this. So you guys better come up with some way out of this, because that is 100% going to happen. Last but not least, everyone else has said this, so I'll say it again. If the vaccine works, why do I need to get it? If it's raining outside and you're wearing a raincoat, why do I need to wear a raincoat to protect you from the rain? Does that make any sense to you?
Thank you, Marie. Are you an employee or a student or member of the public?
Mother of a student.
Okay, thank you for that clarification. All right, next speaker.
Linda Myers Russell.
Linda, you're on.
Pardon me, I didn't realize I had signed up, but I'll take my 2 minutes. I am speaking in favor of the resolution. I'll be teaching in the fall. I think that we've had a lot of misinformation today. I'll be teaching on campus. I don't feel too much afraid for myself because I have been vaccinated, but I know that I can be infected without symptoms, pass that on to my students who take it home to their younger siblings, to their children, to their grandparents, many people who do not have the opportunity to be vaccinated. So it's a public health issue. You have to have a driver's license to drive on the public street. That's just one analogy. I could go on and on and on about regulations that keep us all safe. This will help keep us all safe. Thank you.
Thank you for your time. We appreciate it. Jennifer, next speaker, and let me just remind everybody, we are going to wrap up at 6 p.m. For our trustees that have been so patient, we're going to take a bio break at that time, and I'll tell you at that time how much of a time we have left, and then we'll go into the action. But with that, let's go ahead and have the next speaker, Jennifer.
Sean Casey.
Hey, thanks so much for your time. I'm a member of the community, member of the public, and I just wanted to voice my support against this measure. I strongly oppose mandates, and I want to offer to the group that there are therapeutics besides vaccines. Ivermectin, vitamin D, as somebody mentioned, that is not misinformation. These are things that will help treat if someone were to unfortunately come down with this disease. And there are other things. I think vaccine mandates is a slippery slope. But I do understand everyone's concern about passing it on to their grandparents or their young ones. The grandparents, everyone who is older than 12 has the opportunity to get the vaccine if they want to. And so that is something I think we should cherish and keep the option open as opposed to mandate. That's it. Thanks so much.
Thank you so much for your time. Jennifer, next speaker.
Courtney Taylor.
Courtney. Going once,
Hello.
going- Yes, you're on.
Hi, can you guys hear me?
We can
Thank
hear
you for your time. I'll be succinct. I have a question. In California, we've seen different, and across the country, different ways that the state and federal governments have been incentivizing, if you will, and encouraging private businesses. And I'm curious if they've been encouraging higher education and colleges like yourself. So my question would be is, in your report, will you be letting us know if there are any incentives whatsoever that have been offered to you at a state or federal level, or any type of lobbying, anything that benefits the school in any way if you do in fact mandate the vaccine? And that's something I think the public would like to know. Thank you.
For the question, and we'll try to address it in the presentation. All right, next speaker.
Lillian Salazar.
Lillian.
Hello, hi there. Yes, can you hear me okay?
We can hear you.
Okay. I'm Lillian Salazar. I'm a mother and I'm also a community member, and I'm completely opposed to this discussion, period. I don't care if the vaccine is FDA approved or not. This is my body, my choice. I'm a native San Diegan. I was born in the United States of America, and what you guys are doing or even proposing is completely unconstitutional. It's a violation of the Nuremberg Code. It goes against my body. This is against my religion and my views. And you guys even having a conversation about this and encouraging people to shame people because they choose not to vaccinate is so wrong. And if you guys don't stop, you guys are going to have a civil war on your hands. And you do not want that on your hands. You guys have already robbed me of letting my child go to a public school because she's not vaccinated. I chose not to because I had a bad reaction to a vaccine. I made that decision. I deserve to have that decision. This is my choice. It's not the state's. You have no authority over my body. Neither does the state, neither does my employer. Nobody does. This is my body. You guys have to remember that. You can't do this to people. You absolutely cannot. And I urge you to ban this bill immediately. Whether it's FDA approved or not, we still have the choice. That's all I'm going to say.
Thank you for your time. Jennifer, next speaker.
Akira Bula. Hi, am I unmuted? Can you all hear me?
We can hear you.
Okay. Hello. I hope my words reach your ears today. I would like to ask you, what happened to our civil liberties? Are we not American? As laws surrounding abortion go, I figure, as both a feminist and a health advocate, your body, your choice. We should have religious, health in terms of allergic reactions, and personal choice options to opt out of the vaccine. I refuse to take a position for or against the vax here today, but I will present this question to you. Since when did we hand over our right to govern our own bodies and sell our God-given decision to take care of ourselves, becoming property of the government? Both the science behind masks as well as the COVID vax are faulty at best. The mask works like barbed wire attempting to stop a mosquito unless you're wearing an N95 mask, which is not mandated, by the way. So you see, it's not about public safety, it's about compliance. People who are afraid should have the option to get vaxxed, while those who aren't should not be forced to get it. For those in favor of the vax, I ask you, isn't the point of getting the vaccine to be protected from COVID?
So why are you worried about catching it if you are vaccinated and therefore supposedly safe from those who are unvaccinated? It logically does not make sense to violate our civil rights and for everyone to have a needle stuck in them against their will. I personally know many healthy and intelligent folks who have been extremely harmed by the vax. From blood clots to immune disorders and problems with the protein coding in their body, it is outrageous and makes my heart cry out at the injustice of our government, which was crafted by our founding fathers to protect us. Please hear me and please do your own research outside of the privately owned corporations, which are supposed to aid the public. Please understand how much money is being made under the table by those who are the driving force of this mandate and how they are manipulating the news. Since when did we start displaying manipulated opinions on the news, which is supposed to present unbiased facts? By the way, mainstream news channels are owned by those in office as well as Big Pharma. They're using the Relief Act, which was last used, by the way, in World War II.
2 minutes is up. Jennifer, next speaker.
Scott Peterson.
I'm sorry, wait, hold on, let me, okay, Scott. Scott, you are up. Jennifer, what's the name again?
Scott Peterson.
Scott Peterson, are you up? Unmuting yourself? Okay, we have 4 minutes left in time, so let's go on to the next speaker.
Sabrina Gudi.
Sabrina?
Hi, yes. I am an employee of CRC. I have worked here for 20 years and served the students, which has been my pleasure. I am against the mandating of the vaccine as an employee. I am concerned that it will cause me to lose my job, which would have a huge financial impact on my family. Also, as other people have said, it takes away my choice for my own health. Just referring to the VAERS, which I'm looking at right now, which is put on by the CDC, I believe, there's 11,940 deaths. And I know that this only reflects 1 to 10% of the actual deaths. So I do have concern for my health. My husband's 67. We have a son. And if we had adverse effects to this vaccine, I worry about my son and what would happen to him. As somebody who's loved working here and loved working with the students, to know that I might lose my job because I don't have the free choice to not take the vaccine, it's heartbreaking. I'm willing to, I'd be happy to take tests and things like that, wear masks, etc. But to mandate that I take the vaccine is just very disheartening. So that's it.
Thank you for your time. We have time for one more speaker. Who's the next speaker, Jennifer?
Pam Ragland.
Pam
Oh.
Ragland.
Hi, everybody. Thank you so much for being the last speaker. The first thing is I really just want to say it's quite concerning that we are not looking at the science. I'm a parent of 2 college-age students, and both of my kids will literally leave the state if this continues. And as a mother, I would like them to stay, but they both see what's going on. As someone else mentioned, there's a lawsuit, there's excess deaths. That's 1 of 11 systems reporting in. I personally spent 10 years in healthcare. I've looked at the numbers and they're falsified. The Lancet published that about the results that there's 0.8% of the effectiveness for the vaccines. And Delta actually started in India. It was called the India variant because of the mass vaccination program. So as we do more mass vaccination programs with people who are really not scientists making some of these decisions, or perhaps people who are being paid to manipulate their opinion, we are starting to have some really bad outcomes in public health. One thing nobody has really talked about is the discrimination against children. My daughter had to drop one of her classes because she's got dyslexia and she couldn't really keep up with the class virtually. That's a big problem with kids with dyslexia. My son who has autism from the MMR vaccine, also another injury from the MMR vaccine. His medicine is $6,000 a month, and it wasn't discovered until age 14. So we're talking about a supposed approved vaccine. He just has had a very difficult time making friends. So there are concerns on both sides. I really support letting people make their individual choice. Thank you very much.
All right, the hour of 6 o'clock having arrived, let's take a 5-minute break among our trustees, and let's make sure we return at 5 minutes after 6. Thank you.
Well, this is Dean. So we've been sitting here watching this. I guess it's a college in California. So I am going to just keep the stream going here, and no, you're stopping it. I'm probably going to pull this video at some point and edit it, and also I want to make a backup of this because I think this could be, if this board decides to mandate that, I think it could be very useful for those affected in that community to use this in possibly litigation for that going forward. So I think I'm gonna just go ahead and pull the stream back up. Said that it would be 5 minutes, so five minutes is not that long. So we'll go ahead and just wait on them to come back. So I'll just wait on them, and then we'll continue the hearing. I think at this point it's they're going to take their discussions about how they feel about what they've heard, and take a vote on I guess what they want to do. I think at this point it would probably make sense for them to say, okay, you know what, we've gotten a lot of information here, got a lot of feedback from the public, from other people in the community, the students, teachers. We probably should take this a little more time, a week, have another meeting in a week or so, and vote at that point. That's what I would do. At this point, it would be very unfair to necessarily make this kind of a decision based on the information that we've heard so far.
Jennifer, are we in reconvening recording mode?
Yes.
Wonderful. Let me reconvene our Los Rios Board of Trustees special board meeting. Our next step is our chancellor to present the action, and after the chancellor presents, I want to just sort of frame how we'll structure the discussion, and then we'll open it up to questions and comments by trustees. Is that, I think that's the most manageable way to move forward. So with that, Chancellor, I welcome you presenting the item.
Thank you, President Ortiz and members of the board. And just a really big thank you for our 7-person elected board. Since we made the really difficult decision together back on March 13th to move to remote operations, because of the concern and all the unknowns involving the COVID-19 pandemic, we have had to make just a series of incredibly difficult decisions as an organization. And tonight is no exception. In some ways, one of the harder tasks before the board and our leadership together is determining the best course to ensure that we're doing everything we can to protect the health and safety of our students, our employees, and our community. So the brief context that is also included in the information item tonight in the resolution is a series of really difficult events that most of us are familiar with at this point, that only 6 weeks ago, it seems like 100 years ago, there was a sense that maybe the worst of COVID-19 was over. And unfortunately, because of the impact of the Delta variant, spike in cases, a spike in hospitalizations, and a fear of what's next. And I want to acknowledge appreciation for all of our speakers tonight who spoke from their perspective and really sort of highlighted how complicated issues are and how strong emotions run on these very difficult and personal issues. So when we look at the options as an organization, I think it's good to hear different perspectives and understand how incredibly complicated the path before the board and Los Rios is in determining what the best course of action is. So in the last 6 weeks, with the increase in cases and some developments both in our state and around the nation that provide context for the board considering whether this next step is an appropriate step, the California State University system last week announced that they were moving forward with their vaccination requirement, even before the final FDA approval, removing the emergency status of the vaccines. And the CSU based that decision on the fact that the Delta variant was so significant and they needed to move forward, as has the UC system. So not exceptional at all in higher education for organizations to be considering taking the step of vaccine requirement in some form. Also in the state of California, the state is now requiring healthcare workers to either be vaccinated or be tested, and also movement at the federal government with the Veterans Administration and other federal employees to explore ways to ensure that more employees and more citizens are vaccinated. So we understand from the conversation tonight, there's a difference of opinion about the seriousness of COVID-19. Our board has been consistent in recognizing that in your judgment, the science and the facts indicate that COVID-19 has been a serious threat to our community, recognizing that there's not unanimity even on that point. In taking steps to protect our students, we have followed the guidance of healthcare experts, recognizing that few of us on this call are epidemiologists or healthcare experts. So as is true in so many areas of life, we turn to those who are trusted, like Dr. Trochet, who have been involved in public health care and have demonstrated that their concern is for the health and welfare of citizens, not some other agenda. So the issue before the board tonight is looking at the possibility of taking additional steps, and complicated steps to be sure, that would result in a higher vaccination rate and a requirement for students, faculty, and staff to be vaccinated. And then we'll have a great opportunity to discuss how complicated requirements like this are. We can learn from other organizations like UC and CSU who have already taken this step. about how to do it and what the challenges are. But again, want to appreciate the courage of the board to have this discussion in public. Nothing secret about it. We had 2 hours of public comments where people had a great opportunity to share both their support and their concerns about this direction. So the resolution before you outlines the health facts as we understand them to be, and some steps that the board can consider that with the goal that the board has always had as a North Star of making difficult decisions in determining what is best to protect the health of our students, faculty, staff, and our community. So Trustee Ortiz, happy to answer any questions or provide any other context.
Can you conclude your presentation and read publicly the recommendation of the report of the item? Or would you like me to read the recommendation? But I do believe that's what we need to focus on, is the recommendation in
Absolutely.
the
Absolutely. The staff recommends that the Board of Trustees consider Resolution 2021-18, directing the Chancellor to develop and implement a COVID-19 vaccine requirement to increase vaccination rates for students, faculty, and staff.
Wonderful. Thank you for that. And before we take up an action or a motion for that, I kind of want to just lay out some parameters of this discussion. And as the board chair, I don't get to really comment until the end. So I just want to do some process comments. Our legal counsel has early in the meeting outlined our emergency authority for this special meeting. I want the parameters of discussion among the colleagues to encourage deliberation publicly, even if there are divergence of opinions. I want to give us all the space to do so in a really respectful manner. We generally work in one voice, but there are times when people have deeply held beliefs, and I just want to create a situation where people feel comfortable, discussing their concerns or support, and just assure everybody it will be done in a mutually respectful manner. This board is a microcosm of society, so we're going to kind of have the same sort of thoughts and opinions. Just remind us all, this is probably one of the most, if not one of the more, if not the most significant decision we will make as a board in our time. That has not escaped, I think, the administration and our chancellor. But, it is our role and responsibility and obligation to be the governing body and to give the guidance to our district on how to handle this unprecedented pandemic. And I don't know if at some point trustees will ask these questions of our legal counsel, but I'm going to make the statement, and at some point they can be validated, because I think it's important. State and federal law clearly gives authority for employers to provide a mandate, not only vaccinations, but to require proof of. State law protects all employees by allowing time off for that vaccine. The vaccines are safe, are free for everybody, and there's no cost. Whatever the outcome of the issue tonight, mask wearing will still be required until our counties lift that requirement for indoor instruction. We acknowledge that this is indeed a collective bargaining agreement, and if this motion as proposed goes forward, we understand and respect that our labor partners will work with us to ensure that negotiations and collective bargaining process will be respected and adhered to. It is my understanding, and I think it's pretty universally understood, that this is not a 10+1 issue in terms of collegial consultation, and perhaps we'll have speakers to address that. So there is a distinction there. I think it's clear that whatever we decide, whether the timing, if we go through with a mandate, will be disruptive under any scenario. And I am confident the district, in implementing whatever we decide to do or don't do, has the capacity and the resources and strength of our team to work through any disruption. I will hold off my other policy thoughts And at some point, the legal counsel may want to just share with us what exceptions exist under current law from the vaccine mandate that we would, of course, honor. And policy-wise, I don't know if there'll be a discussion about expanding those exemptions, but I think current law is very clear. If you have a medical contraindication and it's bona fide, you can present that and be exempted. And indeed, there is a very narrow exception for religion, so those would not be altered. I don't want to argue the science. I think the science is pretty well established, and I think I wanted to put those out there and then allow my trustees to now weigh in either questions from the chancellor or our legal counsel, or just your thoughts on this policy issue. Feel free to raise your hands. I can see the full screen, I think.
President Ortiz, trustees Knight and Wilkerson have their hands raised electronically.
So I'm going to start from what I can see on the screen, and I'm going to open it up with trustee Knight and then go to trustee Wilkerson.
Thank you, President Ortiz. Let me start off that I will be supporting the resolution as much as it is counter to some of my personal beliefs and philosophies. These are special times in which we need to, treat things, differently, like they never have been before. And yes, I stood in line in probably my elementary school in 1955 and got a polio vaccine because I had two classmates that I could visually see the physical deformity that Gary and Vicky had to deal with the rest of their lives. And I too believe in personal choice, and that's why my family has been vaccinated. And people can have their personal choices. We can stay in our house and do nothing, or we can, be more mobile. So I believe a lot of the things people have said, but I think it's these are special times, and we need to take a look at that. And I know there's going to be a lot of details that are going to go into how this is all going to be rolled out. And we know that's always the more, specifics that we're going to have to take a look at later on. But I just want to make my final comment is there's one number that nobody has brought up, and that is how many other people would have died if there had been no vaccination. And that number is unknown, but I'm sure it's out there someplace. Thank you, President Ortiz.
Thank you for your comments, trustee Knight. Trustee Wilkerson.
Yeah, thank you. I appreciate many of the thoughtful questions and comments that we received from public commenters, both for and against the vaccination requirement. But it must be said that some of the comments were a tsunami of false information. I support a vaccination requirement for faculty, staff, and students. Furthermore, I want that vaccination requirement to be verified through the California vaccine website or a paper vaccination record. In the politicized environment we unfortunately find ourselves in, we cannot rely on self-attestation to enforce a vaccination requirement, as too many, as we heard today, deny the existence or the threat of COVID-19. So, that is my starting place. And it's based on information from the CDC and the vast majority of scientific and public health experts. There are, of course, many details to work out. We must offer a robust online schedule for students who can't or won't vaccinate. We need to talk with our labor groups about medical exemptions and implementation. But in the end, we must act to protect the health of our students, staff, faculty, their families, and our community. Without a vaccination requirement, too many of our students are afraid to return to school. We know that because enrollment for in-person classes is down. We need a vaccine requirement to make our campuses safe for everyone who studies or works there. Thank you.
Thank you for your very thoughtful comments. Trustee Johnson, and then we'll go to Trustee Nelson. I'm sorry. Trustee Johnson?
Yeah, thank you. I too am a strong believer in personal choice. My only problem is that there's, personal choice is would be affecting other people, because we know this virus can be inside people without being evident. So I think, and to Trustee Knight's point about we don't know how many people would have died, I think he said would have died, with, but for the vaccine. Also, we don't know how many people would have died if the vaccine had come sooner, because lots of people died prior to the vaccines becoming available. So I think now that we have the vaccine, this is our, best chance to help people prevent from getting it. I would concur with President Ortiz about, I would support some sort of medical, I don't think I'd call it an opt-out, but if someone has, something from a doctor saying, hey, this patient is, has this condition that is not good to have the vaccine with. So I think it would be good if they could show that paperwork and say, hey, I can't vaccinate because of this condition, and they have medical verification from their doctor. I think that's reasonable in my opinion. So I'm hoping whatever regulations or administrative rules we formulate have some sort of exemption like that available as a part of it. So I think that's all I have to say. Thank you.
Thank you, and I appreciate you sharing your thoughts and guidance. Trustee Nelson.
Yeah, so this has been really hard for me. Probably the last 2 weeks have been super hard, just wrestling in my mind and my heart, going back and forth on what the right thing to do, and I keep flip-flopping. But I think ultimately for me, it's going to depend on whether I vote yes or no is going to depend on, is there an alternative for people who don't believe that this is right for them. I believe in bodily autonomy, whether it's for the right reasons or not reasons, it's all subjective. We all have our own opinions. The science keeps changing. I know what I know, but had we said this a few weeks ago, I would have said yes for sure. But now we see that it can still be transmitted even with people having the vaccine. So we can't use the vaccine as a catch-all for everything as a solution, solving all the problems. So I would say, if we can come up with an alternative for those that don't feel comfortable, if they can get tested weekly, if we can do that, I would be open. I would be open to that. But that's my concern is just, it's my core belief of the bodily autonomy, people choosing what's right for them and their bodies. I cannot, in my heart, force people to do things to their body. I don't believe I have the authority to do that.
Thank you. You know what? This is the public debate deliberation, and we respect that there's a diversity of opinion. So thank you for sharing your thoughts. Trustee Gallinado.
Thank you so much, President Ortiz. So what I'm doing for the purposes for our members of the public who are still on the line. Hi, my name's Jen Gallinado. I'm the student trustee for this year, and I understand and hear all these concerns. I truly do. I've been on calls all day and in the last 6 days trying to figure out what my decision would be, because as many of us here have already said, This will be the hardest decision any of us are going to make tonight, and we will not be able to please everybody here. I understand and hear your concerns, your worries, and your fears, and they are very much validated. And what I'd like to ask of our members of the public, specifically if President Ortiz and our clerk of the board does not mind, I'd like to ask our members of the public to please raise their hands if they are students within the Los Rios district. I'll hold a minute before I continue on with my thoughts. Just watching the participants list, I see a good handful of them, a very good handful of them. And I'm curious to know, has anyone ever reached out and asked you what your thoughts were on it? I know in my role, in my capacity, my constituents are you, and I have not had the opportunity to reach each and every one of you, as there's 70 to 80,000 of you. I recognize and realize that amongst all 4 of our colleges. But what I'm trying to do right now, and the reason why I ask this is because more than ever, students are to be a part of this conversation. It's why I'm here. But I do recognize and realize in my capacity, there's only so much I can do. And tonight, I'm a little bit hesitant to say what my decision is tonight. I don't know if I can say yes. I don't know if I can say no. I know the option that is also presented to me is to abstain, but I will not choose to use that decision only because I need to represent my constituents, and my constituents being at the very end of the day, the students and the faculty that are here in the Los Rios district. And therefore with this, I understand, and again, back to my point, recognize these fears, all of them, each and every single one that was voiced here tonight in the 2 hours of public comment that was made. I actually recommend is to table this item until the next, only because I do recognize the fears and concerns and worries this may bring. I know we want to take immediate action to protect our students at the end of the day, because we serve the very students who attend these schools, but the safety, the health concerns, the concerns that were expressed here tonight in 2 hours worth of public comment, I can't say I can make a definite decision tonight. And it's heartbreaking for me to say that. And I apologize to those who say that I am not able to make that decision tonight, but it's because I think of you when I make these decisions. These decisions that I make, and for all of the trustees here, we make them on the behalf of the constituents we serve, not out of our own interest. Therefore, I apologize for not being able to make a decision tonight. And I also apologize to our students for not having serving you better, and our continual constituents. And I'm trying to understand and make light of all of this as you are, as we are going through such an unprecedented time. So I apologize on my end, and I'm trying to do better. And please be patient with me as I figure out how I can best serve you along with everyone else here. But for now, I'm sorry to say I cannot make a definite decision on how I will vote on this resolution, given with what was presented in 2 hours of public comment and so much more, because I want to make sure that this decision that I make at the end of the day is for our students and for the benefit of all here.
Thank you, Jen. And we can hear your passion on this issue, and we respect it. Whatever the outcome is, you have not failed yourself or your constituency. And, it is a tough decision, and we respect that. And so please don't in any way feel like you are not fulfilling your obligation. In fact, the fact that you are so thoughtful suggests you are indeed committed to this. So please, thank you for that. Trustee Haynes.
So thank you, President Ortiz. I waited. I really came to this meeting to hear the comments of my colleagues, and I would add my my support for the comments that have been made by Member Wilkerson and Member Johnson and Member Knight. This is we have all said how difficult this decision is, and it absolutely is. When there were those who spoke this evening about personal rights and versus civil rights, those resonate with me. I've spent most of my life fighting on behalf of both of those issues. Um, I um, I carry around. I don't have it in front of me. Yeah, I do. I carry around this Constitution. I've given it to every one of my grandchildren. It is a very tiny document. It's the Constitution. And I am continually reminded of two aspects of the Constitution that are critically important, and they are tensions. Within the body of the Constitution is the personal freedom, individual rights, but also within the Constitution is about the common good. And so tonight, that's what we're talking about. That's why this is such a difficult decision, because I think if we believe in those two aspects, we've got to struggle with when the appropriate time is to go with one versus another, because sometimes they don't align in a way that we can be in service to both. And so for me, this is for me about the common good. We as electeds are making policy decisions sometimes on personal rights, but in many times, as Jen said, there's 75,000 or 70,000 students, and there are employees, and there are employees' families. And if COVID hasn't taught us anything, it has taught us that when we didn't have a solution relative to a vaccine, we saw deaths in the 600, over a half a million folks. And so, and within my family, I have had a family member who had pre-existing conditions, that was hospitalized for 3 weeks, couldn't come back home, was near death. And so I feel the pain of those who have that to look at and to respond to. So, but I'm also compelled by the Delta variant and what it is doing to young people, in a way, and children in a way that if we do not get the numbers um, of individuals who are vaccinated, we are looking at closing down everything. We're looking at starting over, and we're looking at increased deaths. Um, so that's my struggle. Um, and that has to be the preface of sort of the common good relative to the decision I have to make tonight. I would agree with Member Wilkerson that in support of this, we've got to make certain that what we are requiring and what that attestation is relative to making certain that we are getting documents that are reliable. I think it was mentioned, the need to make certain that those who have contra illnesses, that is reflected as well. This has to be comprehensive, and it also has to be documented as well. We do not want to be in a position, in my estimation, of trying to solve one issue and then causing challenges and problems for others. And so I would be making certain that that our operational piece reflects that. I would go further also by saying there's a couple of things. I believe that there's an urgency. Um, a critical urgency that we move now. Waiting a week I don't know that it gets us to a better decision. It gets us to more people sick, but I don't know that it gets us to a better decision. I also have some real challenges with the way this resolution is written, because it does not speak to the now. It doesn't speak to the students who are coming on our campuses in the next few weeks, next 3 or 4 weeks, who we're not directing our district to do anything about that. We are expecting that our faculty, that our staff, that our administrators move in terms of getting a shot, but we say nothing about the students who are coming to us in the next few weeks. I think that it is important to be inclusive of those students, and that if indeed we are, then I would be directing the district to make certain tomorrow to be doing a blast at least letting students know, one, that this is an upcoming requirement, and then two, that that I think we started off this conversation by saying that our chair said that vaccines are free. We need to let students know that. I've also mentioned to our chancellor that every one of our colleges should be offering vaccinations. We have community in our name. It's called the Los Rios Community College District. We are not just an isolation. We are part of the community, and our outreach has to reflect that as well. I would also say that we also need to make certain that we let our students and our faculty and our staff know where are the places that they can go and get vaccinated immediately. We do not have a lack of vaccines. What we do have is a lack of urgency. And I think that one of the things that will happen is that for folks will recognize that there is an urgency. The other thing that I have said, we've got the Puente program, we have the EOPS program, we have the Umoja program, we have the RISE program, we have a number of partners in this, and we have the community. We have community partners. We need to make certain that we are outreaching to them and asking them to help us in pushing out what we need to do in order to make for a much more safer community, both on our campuses, but also in our surrounding neighborhoods. And so I'm not certain. And so I say that because I recognize that this resolution is the beginning. But what I would say is that I am uncomfortable with the resolution that basically says the teachers, the faculty, the classified need to get a vaccine, but they're not speaking to our students who are coming on our campuses. So I'll leave it with that, and if anybody else has things to say, but I'm very supportive of this resolution. It's moving in the right direction. We need to do a little bit more, I think, though.
Thank you. I want to make sure, because I always speak last, and after I speak, then I would invite a motion. But Jen, you still have your hand up. Did you want to speak again?
I did. I just wanted to actually pose one question, and it might lead into more, if you don't mind. The first of it being to our Vice Chancellor Ross, and legal counsel being, if this passes tonight, because I know what my vote would mean, and it's an advisory one, unfortunately, or not so unfortunately, but what is being done as in terms of marketing this out and information for our students who wish to take the vaccine? Because I do resonate with what Trustee Nelson said. We can't force people to take this. I'm looking at the comments in the Q&A too, and I know I should not be, but I recognize that people have a constitutional right. I do not want to be infringing on students or faculty's First Amendment right. I do not want to be infringing on the 14th Amendment right that's being brought up in that chat. I do not want to be infringing on anyone's 10+1 and 9+1 rights. So if we leave the students and the staff and the faculty up with the option to take the vaccination, what information are we putting out there for these parties who are interested or making the decision to take the vaccine? And how are we going to do it? And what else needs to be done? The biggest thing is going to be education. That's all I can say. And I'll pause with my further commentary to allow them to answer.
Well, let's hold off on having staff answer, because the challenge is the resolution directs the chancellor and his team to go back and fill in the details. To the degree we as trustees want to provide some guidance to that, as they go off, if this passes, then that would be appropriate to include in a motion once we receive a motion. So I think your point is that if indeed there's a majority of the board that moves forward and gives that authority for the staff to move forward, that you would want to have a solid messaging to students and staff. So is that a correct articulation in terms of educating our students and staff that you would, whether or not you vote for a measure, is that sort of an important element for you that you'd like to see? And or, I don't want to put Gabe on the spot, but I don't even know if you're prepared to answer that, but is that sort of your desire to make sure that we fully educate everyone that might be covered under a potential mandate?
President Ortiz, was that posed towards myself or?
Yes.
Oh, okay. So yes, that's one part of it. And also I wanted to touch upon the point that Trustee Haynes brought up about being able to comprehend this resolution. I myself am having some trouble comprehending it as well. And there are some amendments that if allowed, that I'd like to see implemented in, because education is a part of it that I'd like to see in there. It's not mentioned in there. The other part that I'd like to see is that we talk a lot about proof of vaccination or attestation. How are we going to go about that and verifying that? So those are questions that I have. And I also like to point us towards resolves, be further resolves, I believe 3 and 4 for our chancellor to speak further upon when that comes about.
So let's do this. Let's ask the chancellor to the best. I agree. It's generally too general and broad because generally we give them delegation of authority. But I'm hearing from you and other trustees, there are certain elements that if we give them that authority, that should be included. So I hate to put anyone on the spot right now, but I think, Chancellor, it is appropriate to answer the question regarding perhaps whether we are anticipating an education or marketing component. Mm-hmm. And I think the question about attestation versus, mandate requires proof of verification. Attestation is not being proposed conceptually at this time. And I'm hearing from some trustees that maybe they wouldn't go for that. So if what I'm hearing you say, Trustee Galanato, is that you would like the option of self-attestation, you're free to ask that, but I'm just not sure where that is in terms of the likelihood of it prevailing. So that's just a point I would put out there. And then I think the question about proof of vaccination, I think technologically for students, the staff are ramping up aggressively to try to get something. But, if we direct with this resolution tonight to go forward, then they would come back. And my sense is and I think the really critical issue is, does this happen in time for the fall session for our students that are already enrolled? And if so, we may go through some disruption on that. So I think I've captured yours, and I don't know, Chancellor, if you want to address any of those elements. And then again, I want to address some things in my closing comments before we take up a motion, but I want to give you the opportunity, Jen, to have your questions answered.
Well, and several good questions and comments. And President Ortiz, if it's okay, I'll quickly walk through the 5 resolved, which is what the direction is to us. Share what my and my staff's understanding is of what our charge would be if the resolution is approved, and recognizing that there may be ways to increase to amend the language to provide greater clarity or about what our understanding is. So the first resolve is that we would develop the requirement consistent with applicable legal requirements and a lot of conversation and opinions about the legal issues. Our general counsel, Jake Knapp, is very up to date on what the legal issues are. And the resolution specifically notes the health and religious belief exceptions. So those are required by law. That's established constitutional law. And we would be attuned to any changes in the legal opinions. The district court in Indiana, for instance, has upheld University of Indiana's requirement for student vaccines. So the law is evolving on student vaccines. There is a really deep amount of law on employer requirements involving health issues. For instance, we require tuberculosis testing before employees can be on the job. So understand that any comparison is wrought with difficulties. They're not perfect. But on that first point, we absolutely will stay attuned to the law and comply with the legal requirements. And General Counsel Knapp, anything to add on the legal issues?
Thank you, Chancellor. Yeah, I would just add, there have been a lot of legal references thrown around over the course of the last few hours. But just generally speaking, and to try to keep it concise, there's a long history of case law, including United States Supreme Court decisions that support the right of the government to require mandatory vaccinations. And the cases that have arisen out of California have continued to follow that authority, generally speaking, and have upheld vaccine mandates, including just last year, a very recent California Supreme Court case that was brought against the University of California for their influenza vaccination mandate that the California Supreme Court upheld as legal. Additionally, we have statutory authority under the California Constitution and the Education Code in California. They make it clear that community college districts in the state have broad authority to act in any manner that's not in conflict or preempted by other laws and that are not in conflict with the purposes for which community college districts were established. And that's the reason why the state chancellor's office issued a legal advisory recently within the last month or so that agreed and said that the authority for vaccine mandates rests with local districts and not with the state. And I won't continue to belabor the point, but one other recent legal development, just last week, PERB, the Public Employment Relations Board, issued an opinion again related to a UC flu vaccine requirement. And the issue there was related, obviously it's before PERB, so this is about collective bargaining and labor relations, but PERB issued an opinion last Tuesday that said that it was clear that the UC had the authority to mandate vaccines for employees, but did also note that there was an obligation on the part of the UC to come to the table and bargain the effects of the decision to require a vaccine mandate. And we will, of course, continue to work closely with our labor partners and meet all of our legal requirements, come to the table to bargain effects if the district receives direction from the board to move forward with a vaccine requirement.
Thank you, Jake. I think that's a concise overview of the legal issues and a good segue into the second resolve, which is that if approved, the direction would be that the requirement be effective for employees. So the second resolve involves employees, the third students, and important issues in both groups that are different that we want to be very sensitive to. As General Counsel Knapp noted, a decision from the Public Employee Relations Board just in the last week or so that provides a clear roadmap of both the authority, if the board chooses to approve the direction towards the requirement, but also clear guidance about what the appropriate pathway is to negotiate the impacts. We, as we always are, have been in close contact with all of our labor partners. We have wonderful leadership in all four of our collective bargaining units. So we would, as we always do, work collegially with them and address the impacts, even if there were not a PERB decision. That's the way our district rolls. We wouldn't have to be told to by PERB, but the PERB ruling gives clear guidelines on what we would need to do. So a related development, some of you probably saw the Kaiser Health System statewide has adopted a requirement for their employees. Their timeline is very similar to what is included in the resolution. And even for a healthcare institution, they're recognizing that they want to engage in appropriate conversations with their labor partners. So the goal for Kaiser is to have the employee requirement in place by the end of September. And this draft language says October 1. So other organizations looking at a timeline similar to what our staff thought was an appropriate timeline. And again, no later than that date. If the direction is to move as fast as we can, I think we've demonstrated together with the board and with our staff that when we have to move quickly in addressing a crisis, we can. The third resolve is the requirement for students. And the language, and Trustee Haynes was talking about what the timing is for students, and in a lot of ways, very complicated in providing the information to our students back to Student Trustee Gallinado and other. We want to do everything we can to continue the educational efforts that have been very robust to share information with our students. We can always do better. And classes start on the 20th. So just recognizing that actions we take to impact students for the fall are complicated, and in no way do I want to indicate that the administration or I are reluctant to move as quickly as the board instructs us to move based on your guidance tonight. We recognize that if the direction is to move in a certain direction, we want to get there as quickly as we can, recognizing the complexity. So the board's direction is at a high level, which is appropriate for the board to be establishing policy, and has happened on all of the implementation issues throughout the last almost year and a half since March 13th, when we recognized we were in the midst of a pandemic and we're going to have to operationalize a lot of issues. We've regularly communicated with the board, but the board has entrusted me and those who work with me to operationalize your decisions in consultation with our labor partners and other stakeholders. So that's the third resolution with respect to students. The fourth we've talked about in some detail, just noting specifically that we always do and will continue to do the right thing in consulting with our stakeholder groups. The labor groups have a legally clearly defined role in negotiating outcomes. But we had a cabinet meeting yesterday. We regularly engage with all of our stakeholder groups. We'll continue to do that, and questions will arise. And if the board takes action on the resolution and directs us to move in this direction, the conversations are already underway. They will be robust. There will not be consensus on many of these difficult issues, but there will be an opportunity for people to be heard, to express their concerns, and to do what we always do, which is work with our employees in their best interest, and hear all the voices in arriving at the tough decisions. The final resolve just notes that information is changing really quickly. We've talked about what a different place we are in now than we were 6 weeks ago. I have no doubt that what we know will change dramatically over this next 6 weeks. So the resolution just acknowledges how rapidly changing our knowledge is and the information we receive, and is noting that we have and will continue to respond to a changing circumstance. So I think the resolution addresses the legal issues at a high level. It acknowledges the importance of the two groups, employees and students, and recognizes that there are differences between implementation for those two groups, and acknowledges, I think, the complexity of the task that we're discussing tonight. So I'll pause and hope that that answered the questions and issues raised, and open to respond to additional questions and direct those to staff who have greater expertise on certain areas than I do as well.
So I want to go around one more time, and because I reserve my comments and for the end, and then after that I generally invite a motion. But let me just see if there are any remaining. Tammy, do you have any? Tammy has further comments?
I do. So we still haven't really discussed the alternative for weekly testing. And I mean, my vote's going to be dependent on that option. So I don't know if that's something we can discuss now, or if I just have to say, all right, I'm going to put it in your hands and So be what it is.
So I think the appropriate thing, because we all have sort of our wish lists, the appropriate thing is to go on the record and say to the chancellor what you would like to see.
Okay.
And then depending on where the motions go, whether or not some of the stated desires and direction of trustees would come down to whatever motion. So if you could clearly articulate what it is you would like to see relative to weekly testing.
Got it. So I would like to bring up the alternative, if people don't feel comfortable with the vaccine, that they have the option to get tested weekly, on a weekly basis. And we make that readily available to them as easy as possible.
Okay, that's a clear desired policy direction.
Clear desired. Thank you.
Noted, and we'll see where we ultimately end up in terms of a motion. Jen, did you have your hand up again? Jen? Okay, go ahead and speak.
Oh, I realized that Trustee Wilkerson had her hand up before mine.
Okay. Kelly, please comment, and then we'll go to Jen, and then hopefully I can weigh in.
Yeah, I guess I just wanted to add, and I mentioned this, but one thing that I would like included is that verification will be required. Kind of point, I mentioned to the chancellor that UC Davis changed from a self-attestation to one that requires either a copy of your paper vaccination record or access to your California vaccination record. So I have my doubts about the efficacy of a vaccination requirement, and I want to make sure that if we are going that route, as I hope we are, that students can feel confident that students, faculty, and staff are actually are in fact vaccinated if they say they are.
Thank you. Jen.
Okay, so my question is more surrounding a question that was posed earlier. Now that we are proposing alternate methods, I recognize that there were a few questions from, I believe, students, and correct me if I'm wrong, members of the public, that if they choose not to take the vaccination, are they just regulated to taking courses online? Because, I mean, from the student perspective, I'm stepping out of my role for the trustee for a quick minute. I can't tell you enough how hard it's been having classes online. Students want to come back on campus. I can't emphasize this enough. I've talked to some of the Senate presidents. I can't even speak to what's happening within our own student leaders. They are having a hard time getting their boards together. I also recognize that if a student doesn't take the vaccination and they're just regulated to taking them online, are we going to get some backlash for that? Additionally, I'd like to also pose is with the alternative methods that are being presented, should it be included in the resolution when it's in its amendment process? What is it going to look like for students who haven't taken the vaccine? Do they take classes online, or are they allowed to go back in person with the proof or attestation as presented? And one other question, and I promise, at least I think I'll be done with questions, is with these amendments being presented, does this come back to the board after it's been amended for readoption or approval?
So just to clarify, Jen, the resolution gives general guidance. This is your opportunity not to make amendments, but to articulate, if there's a motion tonight, what you would like to see in it. And generally, as these things go, when there will be multiple resolution or motions, let's hope not too many, and your recommendation may prevail or not prevail. So this is your opportunity to go on the record. And as I noted, what you are concerned about is what are their options for students if they are not vaccinated? Is it online, despite all the challenges? and or is self-attestation sufficient? Which is, just to clarify, self-attestation is contrary to a mandate. A mandate requires proof. So, well, people can play with the words, but it really is a mandate. If you have to prove you've done it, you can't. Self-attestation, I don't think is envisioned in the language of the resolution, but I'm hearing you say you would prefer that as an option in lieu of. Pam, I see you. I just want to make sure we're capturing Jen's. So I'm hearing you say, and I'm not concurring, and there may be debate about this, but I just want to make sure I understand what your policy guidance to the district to go back and develop would be. One, if students can't or don't take the vaccination, are they limited exclusively to online? Or will self-attestation that they've been vaccinated, i.e. not requiring proof and verification, will that suffice for on ground? Are those your 2 points?
Yes, that is. And I know there was another point I had, but I'll hold it because I can't remember the exact wording of it.
I see the staff are probably anxiously writing this now. So the clearer we are, it has to be incorporated in a motion, depending on where the majority of the, but this is the forum to put it out there. So what's the third one?
I apologize to our staff on so many occasions. So again, I brought it up earlier in resolves 3 and 4, and dates are mentioned. So my biggest concern, especially around resolve 4, where spring of 2022 is listed, what if a student has not met that vaccine requirement? And the same to also be reflected in resolve 3, where October 1st, 2021, during the fall semester, is mentioned as well. What happens then? That's just a general question. I'm not posing it as an amendment by all means, but I am curious to know is there a consequence for that? And
okay,
yeah.
Got it. That's helpful. Pam, your turn.
So my question actually piggybacks on something that Jen said and the request that Tammy made in terms of adding. So my question goes to, if indeed the language is accepted of having a weekly testing option, would that not help those students who may not want to be tested, or those employees who do not want a vaccine, who do not want to vaccinate, but don't have a pre-existing condition, or don't need an exemption? Would that allow them to then take on-ground courses? So that's
if you get tested weekly.
If you get tested weekly, because I think that may solve part of the challenge. I just think it's really important that if we're doing on ground, I think that we start the vaccinations basically immediately. But then if we have a method for those who, for whatever reasons, they're willing to be tested, and I think we have to help to make that easy for them to do so. Then would that be?
So if I could just weigh in,
yeah,
I think there's kind of a blank slate now.
Yeah.
And if it's your desire, I mean, the district is looking for guidance.
Mm-hmm.
And what I'm hearing you say, which I'm not sure I'm there, but in lieu of vaccination and proof of vaccination, would weekly testing suffice for on-ground students, faculty, staff, et cetera?
That's a question. It really is a question.
We can do whatever we want, and that's what the state is doing. If you refuse to do a vaccine and you're working, in an office, you're, number one, required to wear a mask, and number two, you're required to test periodically. So that is a model that the state is embarking upon.
I'm concerned about the periodically. That's ambiguous, and so.
And I say that because it may be weekly. I think the state.
And I am concerned about that particular option. But I'm just trying to get some idea of answer.
We can do whatever, I mean, they'll do whatever we tell them to do. I think this is a conversation about what you would like.
Yeah.
Are you?
Well, so for me, I want to see the language and that be it resolved. I'm not altogether supportive of district students effective no later than at the beginning of the spring semester. It appears to be a requirement. I think it's sort of way down the road. I recognize that and have been told, well, everything is going to move is going to move with deliberate speed. And I'm not sure if who said the deliberate part, but
so what I'm hearing you say is you don't want to wait till spring.
Exactly. I want that to be happening immediately, as immediately as possible.
Got it. Other trustees, questions, comments? Okay. I'm gonna try to address a number of things and actually convey my desire and my guidance, if indeed whether it passes or doesn't. But I think I want to address. Well, I want about the public comment. There were thoughtful persons who have deeply held beliefs contrary to vaccines, and we respect that. But there's also were a whole lot of people that, as Trustee Wilkerson conveyed, that simply were wrong on the science, on the law, on the notion of whether or not this is a Nazi state, which is really, really troubling when that statement is thrown out. I mean, I think we clearly somehow got on the list of a group that is ideologically probably opposing this, when many people from San Diego, I didn't realize our district reached out to San Diego. Certainly people, whether I disagree with them or not, have religious beliefs about this. And so let's be thoughtful enough to sort out. More public comment doesn't necessarily define what is sound public policy or science. So I need to say that. And I think one of the things that was I really want to address was the line of comments that said, the vaccine doesn't work because we're having breakthrough and we have the Delta variant. Well, we have the Delta variant because so many people are not vaccinated that the mutation among unvaccinated persons created that risk of breakthrough for those of us who've taken a vaccine, who want to protect ourselves, as well as people in the community. So the statement that, gee, people are getting COVID because of the vaccine, because they're vaccinated, is simply contrary to all science. And Dr. Trochet is a little understated. But what is clear is a Delta variant is a result of unvaccinated persons. And I think we ought to be cognizant that public health and herd immunity is really at risk with a worldwide pandemic. And we will see more mutations. So that is not an argument against the vaccine because we've got breakthrough. We have breakthrough because people are not vaccinated. And you know what? God bless them if they don't want to be vaccinated. But we as a governing board have an obligation to protect our students, our faculty, our staff, and the community. So, I just think it's really important for us to understand and sort through, because there's, X number of persons or percentage that weighed in on public comment, that doesn't validate so many of the statements that were made. So I mean, we've already outlined our legal authority. I mean, you know, we could go ad nauseam. I don't want to address every incorrect statement about legal authority. I do think there's something that's important to be shared. The notion that somehow, because there are low rates of vaccination by communities of color, Pam and I, we are Latinas, we're African Americans, you know, Dustin, I mean, it's very sad that we have those low rates, but it's precisely the reason we need to require students to be vaccinated. We've had since January, public education campaigns, culturally designed, and we haven't broken through. That doesn't mean it's right. It doesn't mean we're wrong to step in and say, you know, we can do a mandate to protect our staff, our students. And, you know, it is not our job to try to break through whatever reasons students of color are not getting the vaccination. Our obligation is to protect those students if they choose to come to our college. And there was also comments in various sources that requiring a mandate that we're somehow, you know, want to, well, it'll serve as a disincentive for student enrollment, and our student enrollment will go down further. I actually believe our student enrollment will go up when students feel comfortable. And if we see a dip, I mean, our obligation isn't simply to chase enrollment numbers, although it's very important because our enrollment is down because of COVID and other factors. Our obligation as a governing board is to make the right decision, policy-wise, governance-wise, and, you know, to have the courage to do something that is controversial. I mean, we didn't sign up for these jobs because it was easy. And so I just really feel compelled to share that. Policy direction. And again, I'm putting it on the table. I don't know where the motions will go, but these are my thoughts. I do believe, despite the fact that it's 17 days until fall semester, that if this board takes action to require students and faculty and staff to be vaccinated for the fall semester, that we need to do that turnaround and send out notice immediately. Even as the staff and our chancellor and his team negotiated with our represented groups, it is possible for students to get vaccinated in that period of time, and or we'll delegate it to the chancellor and his team. There are ways to say proof of first vaccination by the date you're stepping onto campus. And I concur with you, Pam, and I've said it to the chancellor. We ought to have on-site vaccination that first week of classes. Let me say this again. We have the resources in the community. We have partners that will step in. Dr. Trochet said the Medical Society would love to participate. Our hospital systems would love to participate. There are numerous nonprofits that are doing this and are on the ground. But if we turn around and we take action, we need to immediately inform our students. We need to give them links to all of the sites that they can walk in and get free vaccinations. And we need to have on ground that first week. And I do believe, as disruptive and challenging it may be, that we cannot delay this any further. I would like to see on-ground vaccinations provided on our colleges at that time, you know, for the fall semester. So yeah, I always get those mixed up. Let me also say that, I mean, we'll say it 12 times. Of course, we're going to ensure that any mandate, and I am in support of proof of vaccination. I think self-attestation is a false comfort level that we need to, that of course we will honor existing protections, bona fide medical contraindications, very narrowly, you know, religious beliefs, The law is pretty well established. We could not contravene those even if we wanted to. It would not be appropriate. So we're going to honor and respect those. And the other element here is I just really want to say to our represented groups, our academic senate, if we proceed with this, and I don't know where the direction lies, if we proceed with this, I am confident that you all recognize how difficult this is, and I am hopeful and confident you will be a partner in this, particularly as it relates to the timeliness. I don't think there's a gray area here. I don't think we have the luxury of waiting 4 months to negotiate, and I hope you receive this in the context that it's intended. You know, we really are jumping into this together, and I am confident that you all will be a partner in this. And we'll have bumps along the way, and the district can extend time for the fall semester for students. You know, we need to be flexible, but I don't think we have the luxury to wait until spring, number one. Number two, you know, Delta variant is just the variant we're seeing now. And I'm not going to debate the science because it's pretty well established. I mean, a month from now, we'll see another variant, and 6 months from now, we'll see another. So my desire would be, number one, we move forward requiring all students, faculty, staff to show proof of vaccination prior to the fall on-ground courses. Number two, I really believe that we need to provide as much resources and information for our students when we provide notice. And we also need to have on-ground, on-site partners providing vaccinations. And I think the issue about whether or not I want to honor the comments by my colleagues. What options would be available for students if they weren't vaccinated to go on ground? I think it's pretty clear. Online is an option. Independent of all this, everybody at this time is going to be required to have a mask anyway for indoor classes, but that mask requirement could be lifted anytime, and we would be dealing with potentially breakthrough cases in a classroom for our faculty, staff, and our students. So I'm not sure my belief or my desire there isn't really an option for students that don't. If they can't be vaccinated, then that's a different issue, and that we ought to respect that. But if they don't want to be vaccinated, I don't know how we can nuance that. I mean, my personal opinion is that there's no in between for that. The weekly testing, I know the state is proposing, if you're masked because you can't or won't be vaccinated, then they are proposing, I think, weekly testing. I'm agnostic on that, as long as people are masked. But that's just to address, I think, a comment raised by others. So that's my desire. I now see hands up again. So let's take some more questions. And at some point, I can't make a motion, someone can. Dustin and then Kelly. Dustin, do you want to make comments? Dustin? Okay, Dustin, well, Kelly, let's go ahead. Oh, Kelly, please.
Sorry, I think I was muted.
Oh, okay, Dustin, go ahead.
Yeah, I was gonna ask, I'll move the item?
Yes, and
is that okay? Yeah,
what would you like to move? Because there's a lot of moving parts on
the resolution. I move that we approve the resolution.
Well, let's hold off because I think the resolution ideally would provide more specifics, but that's just my opinion. Let's hold off until I hear from Kelly.
Oh,
President Ortiz?
Yes.
Sorry, just to interject really quick here from a Robert's Rules of Order perspective. Yeah, if we
There's
want
a
to,
motion, I could ask for a second.
we could ask for a second, or you could ask if Trustee Johnson would be willing to withdraw his motion just to continue the conversation.
Dustin, would you be willing to withdraw your motion for the moment for the absence of a second, and then we can revisit the
oh, sure, yeah, that's fine.
Okay, and we may return to your motion, which is a general motion on the resolution, or we may have some details. So let's hold on, let's withdraw, and we'll come back. Kelly.
Yeah, thank you. You know, I just wanted to say that I hear the urgency from both Trustee Ortiz and Trustee Haynes, and I share that urgency, but I am supporting the timeline that's currently in the resolution. And there's two reasons why. One is that I don't believe the district has enough time to do this right in the next 17 days. I want a strong verification process in place, and I believe that will take more time to implement than 2 weeks. And the second reason is that we do not have a full in-person schedule this fall. I can't really say that I'm comfortable with waiting until spring, but I think with a small in-person presence, I can live with that. And I hope that we will be doing whatever we can, including on-campus vaccination clinics, to encourage it throughout the fall semester.
Thank you. And I am going to ask the staff, because my conversations lead me to think we could, but I could be misinformed. Chancellor, and I, you know, this is why you get paid the big bucks. We put you on the spot. So number one, a fall timeline. Can we put a verification process in place? And number two, I think, yeah, can we put a verification process in place?
Technologically, there are tools that are being used. Trustee Wilkerson mentioned UC Davis, and I am a tuition payer for a student at UC Davis, so I'm familiar with their verification. They have a little advantage. They have a little more runway to work through the bugs for the quarter system. CSU and Sacramento State are still working through the logistics. So I don't want to say it's impossible to have a system of verification in place. Technologies exist. The other point, we are obviously prepared. We anticipate whatever action the board might take. So we do have a communication strategy to let students know if the board approves the direction that they need to get vaccinated. That would provide some impetus. We would again provide for the, I don't know how many times, the list of places to get vaccinated. And we would communicate, I think we already have plans, what several trustees have said, that we're developing to have vaccination sites on our colleges when students are back. And I think most of the trustees know, but not all, and not all of the public. We've had robust vaccination clinics on all 4 of the colleges throughout much of the pandemic at various times. So those relationships are robust, easy for us to have vaccination clinics. So shared interest for sure in communicating to students how to get vaccinated. Technologically, could we capture that information, imperfect though it is, as Trustee Wilkerson noted? Yes, we could. Then the other logistical questions are, from a student standpoint, what do we do with that information once we have verification or the absence of it? Those are all logistics that we're planning to work through in the operationalizing process. And we would anticipate coming back to the board with the resolution as is, with the timetable for students, what we think is advantageous. But we also understand the urgency. So on the employee side, the October 1 deadline, as a, again, with the hope that if we can move more quickly with our labor partners, if that's the direction of the board, we would. We don't have any hesitation on October 1st being something we can work with our labor partners. I don't want to speak for all of our staff. You know, Deputy Chancellor and I works very closely with our Vice Presidents of Instruction. Jamie, and you also work with Tamara, and maybe we'll start with Tamara. Tamara, from a technology standpoint, the tools exist to implement a way to capture the information fairly quickly, right?
That's correct. We already have a beta version that we're testing to where we could have students to upload their vaccination cards, the proof that's provided by the My Vaccine Record website. So that is something that we're already working on, and as details continue to emerge, we'll give greater details about how long it would take us for the other items that we've discussed today.
And Jamie, from an instructional standpoint, all of the operational questions, I'll just note some of them that I think the board is aware of. Assuming you have a really effective way of capturing the information of who is and is not vaccinated, the policy questions are what do you do with that information? Do you, from the panoply of options would be open, would students be migrated to a remote form of instruction? Would there be an opportunity to allow them to become vaccinated? And I'm not trying to make it more complex than it is. That's hard to do. It's so complicated. Another option would be to focus on a cohort of students who are on ground and already enrolled for the fall, and prioritize students who will be learning on ground in the fall, and recognize that the students who are studying remotely could possibly be another tier in the efforts to move rapidly to encourage students to be vaccinated. Jamie, do you have anything to add?
I think you've covered a lot of the issues that we'd be grappling with for implementation. To give a sense of the scope, because I've heard it mentioned several times, we have about 64,000 unduplicated students right now registered for the fall. We have 7,500 unduplicated students, so that's 7,500 individuals currently enrolled on ground for the fall. So you're looking at around 12% or so of our student body is currently in at least one class on ground. The majority of those students are also in online courses. We have about 1,500 students who are only enrolled for on-ground courses. That number makes a lot of sense to me because of career education programs that are not offered online. So some of those impossible to convert that we had offered previously. That's about the number of students you would expect to be in fully on-ground programs.
I'm sorry, what was that final number, Jamie, total for on-ground for fall?
The total is 7,500 total. And again, most of those are taking some combination, probably majority online with a single course on ground, but there are 1,500 students taking on-ground courses exclusively.
Got it. And that 7,500 is hybrid. So if you back out 1,500 out of that 7,500, we're talking about 6,000 online?
Well, 6,000 students are registered of those on ground, but they're also taking additional courses that are online. So they're not just solely on ground. They've taken courses that are online, and they've registered for courses
online and on ground, and 1,500 exclusively on ground.
Yes, that's correct.
Got it. So, yeah. Kelly, thoughts on kind of what the district has shared?
I appreciate that information. That was actually really helpful. And I can see two parts. One is that that since we have a small on the ground presence, it doesn't have the same community effect as if we were having all of our campuses, fully on the ground. On the other hand, it makes it easier to implement and communicate with those students. So I guess I need to do a little bit more thinking about the timeline. I was comfortable with the timeline that's in the resolution, and that information makes me more comfortable with speeding it up.
Thank you. And I think whatever way we go, whether it's spring or fall, there are going to be bumps. That's okay. I mean, this is a huge shift, but I am grateful that the staff has been, I mean, you guys have been working nonstop. I'm grateful that you guys have been putting, particularly IT and Jamie, I'm grateful that you guys have been ahead of us in some respects. So wherever we go, thank you for what you're putting in place. Dustin, I know you have a motion that you withdrew, but let me see if there's any other comments by trustees. I don't see further. Pam?
I think Jen had her hand up first, and then I'll.
And I'm sorry. It's hard to see in all this. Jen, please share with us.
Oh, I was going to defer to Trustee Haynes because I think Trustee Haynes beat me first.
No, go ahead. No, I want, then Trustee Haynes. We're veterans here. We listen to the next generation.
Okay, so my question is surrounding the vaccination spots that we have, for lack of better terminology. How many students have actually utilized and gone to these spots that we have for them to go get their vaccinations? And I also am curious with staff as well, if that's information that's available. If not, I absolutely understand. But I'm just curious how many students know that there are vaccinations on campus, because that, at least this would help me in this decision, because again, it's not an easy one, and if it's offered as an option for students, then I mean, why wouldn't we keep doing that for our students?
Quick response. Many of the vaccination clinics were held when we were almost exclusively remote. So they were community service partnerships for the broader community. Yeah. So we didn't necessarily market to students who were studying remotely, and instead provided information about vaccination options closer to them. And I think one of the challenges that we and every organization have faced is the recognition that cost is not a barrier to getting vaccination. The vaccinations are free. Access after the initial rush has not been a concern. That almost everybody in the Sacramento region is a mile or two from some place where they can walk in without an appointment and get a vaccination for free. So when we do have students and employees coming back on campus, the vaccine clinics focused on our own folks makes sense. So we'll do that. Whether that will have a more positive impact than being able to, the barrier to getting a vaccine now is not high, but we want to do everything we can to make it even lower.
And Jen, to articulate it a different way, is many hospital partners and other nonprofits used our colleges to host community vaccinations. So it wasn't just for our students, our faculty, or staff. It was, we will use Los Rios to do vaccine workshops on these weekends, days. And they did their marketing, and it was open to everybody, you know, depending on eligibility. As you know, that's evolved. I wasn't eligible until mid-March, I think. So they were not Los Rios sponsored for Los Rios employees or staff, nor was it marketed accordingly. Or maybe it was marketed, but it was really community opportunity to use our locations. Does that make sense?
And I want to give credit to Vice Chancellor Rodriguez, who really did a wonderful job coordinating those, and also Associate Vice Chancellor Ross, who did communicate broadly in all of our channels that there was access, and many employees and students took advantage of those clinics that we hosted.
But we don't have the, so thank you for clarifying that. We don't know the numbers because we weren't requiring proof of vaccination, so we don't know. And then the other thing I will say is this universe of employees, staff, faculty, students, we're assuming that 100% of that universe will need to be vaccinated. I think that's an incorrect assumption. I think, and what is encouraging over the last couple of weeks, because of the Delta variant, we've seen more people getting vaccinated. So I suspect that of those students that have to provide proof of vaccination and our staff, that'll be the, you know, lower hanging fruit. I mean, we'll get those verifications, but the universe of those that have not yet been vaccinated will probably be small. I mean, it's definitely smaller than 100%, and it may be, you know, lower with our employees, or, you know, so I don't want us to be overwhelmed with how many people will need to get vaccinated, particularly in light of those that have enrolled for on ground. Pam, questions, comments?
I have a procedural question, and so I'm asking for clarification, and I'm not certain if it's our lawyer who is able to do this. So we have how are we going to handle the number of and maybe even this disparate things we want to change in this resolution? So it's a process question. How should it be? How should we take those one at a time? I have not had this happen. So can someone answer that question for us?
Our lawyer will provide some legal insights from a governance standpoint. The goal of the resolution was to reflect the feedback that we had through communication with board members of the direction, and to give a lot of flexibility for the operational decisions. To the extent that the board wants to make specific changes to the resolution, Jake, I think the normal procedure would be a motion and a second for the resolution as is, and then separate motions to the extent that the board believes that the guidance is not clear enough to me and our team.
So I want to direct this question to Jake. So Jake, you get a motion, you get a second, or you may not get a second for the existing resolution. Am I correct?
That's correct.
Which means that fails.
Correct. Typically, Trustee Haynes, the way that this would work is the floor is open to motions. A trustee could make a motion to approve the resolution as written, and then there would be an opportunity for a second, and then there'd be discussion if there was any at that point, and then a vote on that motion. If the motion failed, the floor would be open again, and another trustee could make a motion to amend the resolution with specifics, and then see if that gets a second. And if it does, then there could be a discussion on that, and then see if that motion succeeds. And if it does, then we'd be moving forward with an amended resolution at that point. There could be additional resolutions or a motion to adopt with the amendments up to that point at any given time. But it is under Robert's rules, it is based on motions made and those that carry.
All right, and so we are. What I'm hearing is that we are required to give the motion as written, or can a motion come prior to that? I'm trying to get to the.
No, any trustee could make any motion. Truly, a motion to amend the resolution as it's drafted, a motion to adopt the resolution as it's currently written, which is a motion that Trustee Johnson already made once and then withdrew for further discussion. But it's really at the pleasure of the board.
Thank you.
And we do have a motion that was withdrawn that courtesy would require us to reopen that motion and see if there's a second. And then we either vote on it, but someone could, and even as that motion is moved and there's a second on the one that as written, Jake,
can be amended.
Well, so at what point could a friendly amendment be suggested? After it fails or before it's voted on?
The friendly amendment process is just barely outside of the traditional Robert's rules, but most public bodies do allow for friendly amendments. Typically, if there were a motion and a second, and let's say hypothetically it was to adopt the resolution as drafted, once there's a second, then President Ortiz, you would open up the discussion of the motion for any feedback from members of the board. And if a member wanted to propose a friendly amendment, that question would be posed to the original motion maker and the second. And if there were agreements with both, then the motion itself that's on the floor would be amended in a very friendly manner, and that would be the call of the question at that point. If that does that make sense?
Yeah.
Yes, absolutely does. All right. I know we have a motion that we will bring back and see if there's a second as it's proposed, but I want to give one last time for people if they have any comments before we seek a second for the motion. And if I miss you, just jump in. John, are you trying to weigh in?
Yeah, Madam Chair, do we have a motion on the floor?
So we do. There was a motion by Trustee Johnson. We asked him to withdraw the motion because we had further input from trustees. He graciously did so. There was not a second at that time, and his motion is to adopt the measure as proposed.
This is Robert. I second the motion.
So we have okay, so the motion is back on the table to adopt the motion as included in the report. There is a second from Trustee Jones. Let's open that up to discussion and see if there's further input on the motion and feedback, including but not limited to friendly amendments, if any. So there's a motion and there's a second. We'll open it up for discussion. Trustee Haynes.
Oh, okay. Oh, sorry. So I want to ask if the mover of the mover of the motion would accept friendly amendments.
And I think we have to get the second also. Dustin and Trustee Jones, would you be open to friendly? Oh, I've got our legal counsel.
Just from again, it's at the board's pleasure, but just to kind of keep it somewhat orderly, because this can get confusing. I would suggest that if a member is going to propose a friendly amendment, that it be a specific friendly amendment with just specific language, and then they could be addressed one at a time, because the maker of the motion and the maker of the second can reject the friendly amendment because that's their motions that are on the floor.
Got it. So this is the time to lay out what you're.
Okay, so hopefully my language will be fine. It is in the be it resolved, the fourth one, which is be it further resolved that the vaccine requirement will be effective for the district students immediately.
Do you want to tie it to the fall, or do you want to just say, okay?
I don't want to tie it. I don't want to. Well, yes, or we can say for this fall school year.
And that's just students, or is it faculty?
Well, this one is just for students. This is a be it resolved.
Okay.
So it would. So if we, yes, it'd be more specific for this fall semester.
And you don't want to include that timeline for staff.
Well, the staff one, there are two separate be it resolves. One is for employees. Right. And so right now I'm focusing in on.
Right, I understand. So, but if they accept the amendment and it's adopted, then there's no timeline for employees, is my point.
I didn't quite read it that way. Is that the one that's up above that one? Yes. Okay. So it says district employees as soon as practicable during the fall semester.
Got it. Okay. So we don't need to.
Right.
Okay.
So yeah.
Are there any other friendly amendments you would like Dustin and Robert to consider? I don't.
This is Robert. I have a question for Trustee Haynes. Does your amendment affect only those students that are on ground, or does it affect all of them, whether they have the hybrid instructional program, or whether they're on ground in vocational ed, or whether they are just totally remote? Does it affect all of them, or just one of those categories?
So so I, to be really honest, Robert, part of my challenge is that those who are online are not likely to, may not be likely to come on campus, and that's a whole nother issue that's not even addressed here. To what extent folks can walk on campus, whether they're vaccinated or not. So
I think the concern is in a closed classroom.
Yeah, so this is really for on ground.
Robert, does that answer your question?
Well, it does if you add those words, on ground, because without those words, that it means everybody, all students.
I accept that.
And I think it says that the vaccination requirement only applies who are accessing
timeline, but we also trust that that's an administrative, internal, how to handle those students that are already on ground. I don't think you want us to give you that detailed of a guidance. Jake, go ahead.
Yep, I'm just to piggyback on the chancellor's clarification, because I want to make sure that I understood Trustee Haynes's friendly amendment that I believe Trustee Johnson was indicating that he may be supportive of. But I heard two different things, and it may have just been my computer cut out, Trustee Haynes. But one was immediately, which I had the same concern, because immediately could mean, you know, this moment. But the second thing that I thought I heard you say, Trustee Haynes, was making the language more or less parallel with what the be it resolved clause for employees is sort of some of the as soon as practicable. But I don't want to put words into anything's mouth.
I didn't say as soon as practicable. And maybe I just haven't been clear. I hate wordsmithing on the fly, so please forgive me. But what I wanted to do is, rather than say immediately, was to say, because it says it's taking out effective no later than at the beginning of the spring semester. I just want to make certain that we recognize the fall semester.
Got it.
That's the key.
Yeah, so I think she's saying fall semester for students, and I think the as practicable really on our employees is a function of how long it's going to take for collective bargaining, I would think.
Right. We know that a factor that's going to take time with the faculty is negotiating the impacts. We also recognize that there are logistical challenges which we can meet in addressing students. So I think the desire of the language was to reflect that we're going to develop a plan to do it for, if the direction is that the board wants a requirement for students, we'll do it as fast as we can. That's what the language is intended to relate. But if the language could be more clear that we're going to implement the direction of the board as fast as we can, That is certainly the understanding of staff based on the existing
The
language.
desire is for the fall semester.
Yeah. The fast as we can is not, will not be helpful, I don't believe, in this. The goal, this should be happening during the fall semester. I mean, as fast, it sounded like the other language was as fast as you can, no later than the spring of 2022. My amendment is to disregard that portion of it, and to and by putting fall semester in there, it says now. It's basically saying now.
Is that clear, Brian? I mean, I think our legal
Well,
counsel understands.
I mean, Trustee Haynes, do you want to put a date on it? Do you want to say by October, no later than October 1st, September 15th? Do you want to be more specific? Or
Excuse me, you can hear all that, right?
Yeah, you did say that out loud.
or I'm wondering if our, if staff has some thoughts on that.
In other words, make it parallel to what we're asking our employees to do, having received a first dose no later than October the 1st.
I support that.
That would be sort of parallel with that and consistent. I don't have a problem with adding that.
Yeah.
And I think Dustin, the maker of the motion, and the second have already acknowledged their support for that friendly amendment.
That's correct. That's fine.
President Ortiz, can I just make sure, just to be really clear, because
Likewise, I'm okay with that.
For the board.
Sorry, Jake, go ahead.
Oh no, I'm sorry, Trustee Johnson. So the friendly amendment, as I understand it, would make the language mirror the student language mirror what is currently in place in the resolution for employees, which would essentially now say we've got the therefore be it resolved, and then 1, 2, 3 down from there. Be it further resolved that the vaccine requirement will be effective for district students as soon as practicable during the fall semester, with a goal of all students having received a first dose no later than October 1st, 2021. Is that correct?
I think that's fine.
I think that's very clear. And again, we understand this is a huge and timely goal, and we are confident that the district will work with students to, if necessary, on that mandate. Other trustees, I'm glad we have a motion and a second, as well as a friendly amendment that appears to be accepted by the maker of the motion and the second.
I'd like to propose, this is Trustee Wilkerson, just one more, hopefully friendly amendment, and that is in the very first resolve, the main one, where it says to implement a COVID-19 vaccination requirement. I'd like to just add the words verified by medical records. I just want to make sure.
Verification, because you just don't want self-attestation, right?
Right. So, so yeah, something that is not self-attestation. So I was thinking the words would be verified by medical records. So that would include the vaccination card. But I'm also open to language that says the same thing.
Can I ask a question regarding that? Because medical records.
Yeah, that's a little broad.
It's way broad legally.
It's essentially a card, and I don't want to rely upon the state database because there are problems with it. But essentially, students can take a photo. I mean, I can take a photo of my card. So verification of proof of vaccination.
Okay, that's fine.
Okay.
But we, I need to ask maker of the motion and the second if that's a friendly amendment.
This is Robert. Indeed, it is.
Thank you. Dustin, are you okay with that additional amendment? Dustin, are you on mute?
Sorry. Yeah. It is a friendly. I'm okay with it.
Thank you for that confirmation. So I know Jen has had her hand up. Jen, do you have further comments?
I do, and it's two quick ones that I'd like to propose as a friendly amendment to the motion maker, and the trustee who seconded it. If we refer to whereas 14, where the line where vaccines are not possible due to medical conditions or sincerely held religious beliefs. Is there a way where we can include an aspect, um, pardon me as I try to find the words for it, where they will not be punished or have any consequence in not having this vaccine, which I am understanding is there, but I'm having trouble understanding that. That could just be me.
So
And
let's
then
have our legal counsel answer that question because I think it's a
please.
legal question.
I gave Milo some beans from my
Milo had
side
beans.
dish.
Oh, good. I'm glad Milo had beans.
I'm sorry, Trustee Gallinado, would you mind restating the question? I didn't follow it exactly.
Absolutely. So in reference to whereas I believe 14 on page 2, in the very last line of that whereas, where it states where vaccines are not possible due to medical conditions or sincerely held religious beliefs, I wonder, is there a better way of phrasing that? And then also including, because this is something that's being brought up frequently, not just by members of the public, but also I believe there was another trustee who mentioned it as well, in correspondence with HIPAA or medical access to records and whatnot. I'm not. I'm trying to correlate this as best as I can.
No, I appreciate that. Can I draw your attention to the the second be it resolved clause?
Yes.
The whereas clauses are preparatory leading down to the resolved clauses, which are where the board is actually giving direction. The first full be it further resolved states that the vaccine requirement will be developed consistent with applicable legal requirements, including exceptions for medical conditions and sincerely held religious beliefs. Does that language that exists address your concern?
It does, but I also do have a question in what is defined as a sincerely held religious belief. I was wondering if that could be clarified as well.
That, but I mean, it's kind of well established.
Yeah, there's guidance from the controlling agencies in the state and also with the federal government, and I can give you more information about what's out there offline if that's helpful.
That would work. My second amendment that I'd like to pose to both Trustee Jones and Trustee Johnson is if I actually pose this also as well to our chancellor as well. Is there a way where we can cite where this information is coming from? Because as I look at it, there are just parentheses that just state according to CDC estimates, and I'd like to see where the information is actually coming from in like a footnote or something.
I suppose the answer is yes, Jake. I mean, and Gabe, who worked on the specific language, there are citations. I suppose we could annotate it.
We could. It's not customary to footnote a resolution, but we could.
I'm not suggesting that would be an amendment to the resolution, but if it would be helpful to the city trustee to see the sources.
Absolutely, happy to share.
Jim, would that address your interest that the primary authors could provide you an annotated version that shows where the citations come from?
Absolutely.
So I know Tammy has her hand up, but just to summarize, Jen, I think the 2 points are valid, but when you do a motion, you want to refrain from either reiterating or duplicating what is in the whereases and the resolution. And it's either implied and or expressly stated in terms of legal standards. You generally don't go to that level of detail, but I think your concerns are sufficiently addressed under the statement by our legal counsel that's in the language regarding legal protections for exceptions, bona fide religious or deeply held as well. And they're pretty well established in state law, as well as statute and probably administrative and case law. So we are protected, and again, we would be foolish to reject, medical contraindications and or so it's in there, and we generally don't say it more than once or that level of detail. And I hope that gives you some comfort level that those concerns are covered. Yeah. Tammy.
So I apologize, but if it's not already on there, could we consider the friendly amendment to have the testing as an alternative?
Oh.
And if not, no worries.
Let me ask you for clarification, because I think maybe a little more information is warranted. Are you suggesting for persons who don't meet the medical exception and or the religious exemption that those persons have the option to be tested?
Correct. So anyone that doesn't want it for whatever reason
Well,
has the option.
That's different than what I asked. So you want a broad, not legitimately persons who are protected to do a medical contraindication and or a deeply held religious belief, if they don't get vaccinated, I don't know what the district's going to do. Everybody will be wearing a mask, and I think, they can decide whether they do testing. But I think what I hear you saying is persons who don't get vaccinated for any reason should be able to have the option of testing.
Correct.
So that's to clarify.
Correct.
Okay, so it's a broad out. Okay.
So can I ask a question regarding that?
Please.
Okay, so let me tell you what my concern would be. It's sort of when you get tested and when you go to class, and when you may be having symptoms that are reflected as a result of the test, of which then there would be a problem. You got tested 3 days ago, and if it's every week you got tested, you show yourself not positive for 3 or 4 days. You don't get tested until the following 3 days if it's a week, and then you go to class in the interim. Now I understand that one would be wearing a mask, but it does add another layer of concern relative to how often we're asking, and then how the COVID is expressed, and especially if you're thinking, oh, I'm going to be fine, I'm going to be okay. So I guess I'm sort of asking, and I'm asking legal or somebody, is a week enough? Is it every 3 days? Is it, and the proof, you have to bring the proof, and do you bring the proof to the teacher, the instructor? How is that going to work?
I think the quick answer is those are incredibly complicated and difficult questions to which we don't have an answer tonight.
Okay.
If we would go the testing route in the healthcare executive order, the healthcare institutions, at least theoretically, have that infrastructure for testing already in place. We do not. Doesn't mean with the sufficient resources and time we could implement. We have some testing regimen for athletes, for instance, but we haven't spent a whole lot of resources so far contemplating the expense that would be involved in essentially providing testing for all employees on a regular basis.
So there is the issue. So there, just to clarify, there is the issue of Los Rios providing that test, because at least you'd know you gave it, because you'd have to keep some record of it, as opposed to somebody saying to you, here's my little slip, I got tested, and yeah, it says on this date, but there's kind of no, you'd have to, how do you verify that and still let somebody go to class?
I think that your question raises another level of complexity to testing. Either the Wall Street Journal or the New York Times, I forget which, had an article on employer required testing and the likelihood it's not covered by health insurance. So medically required testing by law is covered by insurance. So the question of who would pay for testing employee required is just another level to the onion.
Well, and also it's a rabbit hole that one goes down, which could be problematic.
I know we still need to hear from the maker and the seconder of the motion, but I sort of want to just, I think, Tammy, what you're proposing, and I appreciate your deeply held belief on not requiring mandates, and I respect that's where this is coming from. But as a practical matter, to say we have a mandate, every employee, student has to be vaccinated and has to show proof of vaccination, but we have an exception for those who don't want to, not again beyond the legally protected opting out, that you will have those who have refused to be vaccinated to this point continue to refuse to be vaccinated. And it's an impractical outcome. It essentially is the exception that eliminates the general rule of requiring. So for me, it is, we will have everybody opting out, not based on medical contraindication, not based on deeply held religious beliefs, but everybody who is refused and doesn't believe a vaccine is helpful will continue to not take a vaccine without out. And that's, to me, it's a challenge trying to reconcile having a mandate while having a big, broad, general, if I don't want to do it, I will be tested. I mean, there's all the impractical things about when you test and how long you may have exposed someone and who's going to pay for it, et cetera. So I just, I have to say I could not support that opt-out, that broad of an opt-out. But I just need to put my position on the record. And I'm happy to hear your thoughts because I know you feel strongly about this.
No, that's fine. I mean, that makes my decision easier, I guess, in voting the way I'm going to vote. So that's fine.
That's okay. I mean, I understand that. I don't know. Let me ask the makers.
It's okay. It's okay. We all have our opinions about it, and I think we have to vote with the way we believe is the right way to vote.
Well, let's see if the makers in the second will accept your amendment. Dustin and Robert.
This is Robert. I also respect your view on this, Tammy, but for me, it's an utterly unworkable, impractical approach and leaves open a lot of fraud. I'd have a very difficult time including it in the resolution.
Dustin, do you want to share your thoughts? I mean, perhaps you can weigh in on whether or not that's another friendly amendment you would accept. Well, Dustin.
Sorry, what exactly is the amendment?
Tammy would like you to consider, or like us to consider, for those persons who don't want to have the vaccination for whatever reasons, beyond the legally protected exceptions, just generally don't want to have the vaccine, that they be able to test. And the chancellor went through lots of challenges and impracticality of testing and et cetera, but that, that there be an opt-out beyond the current legally protected exceptions, that if a person doesn't want a vaccine for whatever reason, that they could opt for testing. I don't know how periodic that testing would be.
I think I'm with Robert on that. I think it's that seems unworkable. I'm not sure how that would work.
Okay, Tammy, I know this is a tough one for all of us, and we're making.
No, it's fine. It's fine. I respect everyone's opinion on it.
Okay, we have two friendly amendments two friendly amendments on the table from Pam and Kelly. They've been accepted by the maker of the motion as well as a second. Can we have our legal counsel share with us what the resolution looks like before we vote? Sorry to put you on the spot, but.
That's why he gets paid the big bucks.
Let me find my unmute button. So the two friendly amendments, one from From Trustee Wilkerson, adds in a be it resolved clause that we require verification of proof of vaccination. The second friendly amendment from Trustee Haynes changes the be it resolved clause related to student vaccinations. The language I read earlier to the board would make it parallel the current be it resolved clause for employees, which is essentially that as soon as practicable during the fall semester, with the goal of no later than October 1st, same as with employees. So those are the two friendly amendments that have been accepted by the maker of the motion and the maker of the second.
Wonderful. Any questions on that by any of the trustees before we call for the vote? All right. Seeing no further questions, we have a motion, we have a second, we have friendly amendments to that motion. Madam Clerk, would you please call the roll?
Trustee Haynes,
Aye.
Trustee Jones,
Aye.
Trustee Johnson,
Aye.
Trustee Knight,
Yes.
Trustee Nelson,
No.
Trustee Ortiz,
Aye.
Trustee Wilkerson,
Aye.
Trustee Gallinado,
Trustee
Trustee
Gallinado,
Gallinado.
you're on mute. Trustee Gallinado, you're muted. Everybody's muted.
There you go.
Okay, hopefully it's working. Yes.
Yes.
Okay, motion carries 6-1.
Thank you. And let me say before we sign off, I really, really appreciate the depth and the sensitivity and the complexity of this issue and the pressure. And people, hopefully, people feel like we've had a robust and respectful and collegial conversation. And I am hopeful and confident that going forward with this guidance that our other partners will move with due speed in the negotiations. And I really thank you all for just bearing with us on one of the most difficult meetings we've ever had, at least in my time. And thank you, Trustee Nelson and Gallinado, for your thoughtful and, passionate and committed comments. And process matters and respect matters. So thank you. Any other comments or questions before we call for the close of the meeting? Okay, motion to adjourn.
Move to adjourn.
Yay! Thank you all. I appreciate it.